the monitoring of the trends. This way, the observatory promotes the integral development of Latin America and the Caribbean with a focus on rights and equality through the analysis of the social situation of the region, public policies, and technical assistance to the countries that request it. The observatory also integrates a set of digital platforms. The databases are social investment, non-contributory social protection programs, institutional frameworks for social policy, youth and social inclusion, and regional and sub-regional commitments in social development. Through its Social Development Division, ECLAC publishes, updates, and expands these bases, which are available to governments and the general public.
The Statistical Conference of the Americas of ECLAC is a subsidiary body of the Commission, whose mandates include promoting the development and improvement of national statistics and their international comparability. Bearing in mind the recommendations of the United Nations Statistical Commission, the specialized agencies, and other organizations. The mandates of the conference also include the promotion of international, regional, and bilateral cooperation between national offices and international and regional organizations, as well as the preparation of a biennial program of regional and international cooperation activities that, subject to the availability of resources, responds to the demands of the countries of the region. The Strategic Plan 2015-2025 of the conference establishes as main lines of action the institutional strengthening and leadership role of national statistical offices, the development of human resources and statistical production to ensure their quality, and regional and international coordination and cooperation for the development of official statistics in the region. The 10th meeting of the Statistical Conference of the Americas, to be held from the 19th to the 21st November 2019, will bring together authorities and representatives of the national statistical offices and national statistical systems of ECLAC member countries to discuss the future of economic statistics in Latin America and the Caribbean, among other topics.
At present, Latin America is home to 826 indigenous peoples, which, by the year 2010, included nearly 45 million people, accounting for 8% of the region's population. The countries with the greatest proportion of indigenous peoples are Bolivia, Guatemala, Peru, and Mexico. There is huge diversity among indigenous peoples, with some remaining in voluntary isolation and others coexisting in big cities. Brazil has the greatest amount of indigenous peoples, followed by Colombia, Peru, and Mexico. Indigenous peoples represent one of the most disadvantaged groups in the region and have suffered the systematic loss of their lands, with severe consequences to their well-being. Nevertheless, the Economic Commission for Latin America and the Caribbean, ECLAC, has found some progress in recent years related to the recognition of their territorial rights and political participation. There have also been improvements in their living conditions, with greater access to healthcare and education. The United Nations has championed the promotion of indigenous peoples' rights and relies on 3 special resources for this purpose: a permanent forum, experts, a special rapporteur. At a regulatory level, indigenous peoples are protected by Convention number 169 of the International Labor Organization of 1989, which recognized their rights as peoples for the first time, and the United Nations Declaration on the Rights of Indigenous Peoples of 2007, which considers these peoples' rights to self-determination. In the context of these efforts, ECLAC calls for the region's countries to put policies in practice to end inequality suffered by indigenous peoples. Policies based on human rights standards and the perspectives and contributions of these peoples. This is crucial for the construction of a new development agenda beyond 2015, with equality at its heart.
The SDG Gateway is a web platform aiming to become a key factor for coordination and
social no
availability of
contributiva,
the regional assets of the
institucionalidad
United
social en
Nations
América Latina y el
system in
Caribe,
Latin America
juventud
and the
e inclusión
Caribbean.
social y
The
de
main
compromisos
goal of this
nacionales y
online
subregionales
knowledge
en materia de
management
desarrollo
center is to
social.
serve as a meeting
A través
point
de su
and
división de
reference to
desarrollo
all the
social,
information
la CEPAL
related to the
publica,
Sustainable
actualiza y
Development
amplía estas
Goals,
bases
including
que están a disposición de los gobiernos y del
informational
público en
resources,
general.
statistics, regional data, specific analytic tools, and knowledge products developed and provided by the United Nations Development System of the region in response to its
¿Sabías
member
que,
countries.
con información que
Visit
entregan los
this
países,
important
la CEPAL creó un
multi-stakeholder
observatorio
platform
para
and get to
conocer,
know more
analizar
about
y
this
difundir
online regional
cómo
knowledge
planifican en la
management
región de
center.
América Latina y el Caribe para lograr
The
su desarrollo.
COVID-19 Observatory in Latin America and the Caribbean
Concentra
is
en
a
un solo
platform
sitio
promoted by
información sobre los
ECLAC at the
sistemas
request
nacionales de
of the
planificación de
community
la
of
región.
Latin American and
Los
Caribbean
sistemas
states,
incluyen
ECLAC.
los planes
The
nacionales,
observatory tracks the
subnacionales,
public
como
policies that
también
Latin
marcos
American
legales,
and Caribbean
actores
countries are
gubernamentales y de la
implementing to
sociedad
limit the
civil,
impact of the
mecanismos de
COVID-19
coordinación
pandemic
e
in the region.
implementación
Through
y su
reports and
vinculación con la
documents,
Agenda
it offers
2030 y los
analysis of
Objetivos
the
de Desarrollo
economic and
Sostenible.
social impacts that
Es
these
una
policies
plataforma
will
abierta
have
para
at the
quienes
national
estén
and sectorial
interesados en el
levels,
ejercicio
in
técnico,
addition to
político
supporting
y
the review
administrativo de
and
la
monitoring
planificación
in
para
the
el
medium
desarrollo.
and long term.
En especial los
In an
gobiernos,
interactive map, those
parlamentarios,
interested can
académicos,
clearly visualize
sector
the actions
privado
taken
y
by
la
each
sociedad
country in the areas of movements, health,
Observatorio
economy,
Regional de Planificación
labor,
para el Desarrollo,
social
de la
protection,
mirada al análisis y
education, and
conocimiento
gender.
sobre la
Visit
planificación del
ECLAC's
desarrollo en
COVID-19
América
Observatory
Latina y
and
el
access updated
Te invitamos
information
a
on
explorar el
policy measures to
observatorio,
address the
descubrir
crisis
y
in the
ser
region.
parte de la generación de
In
conocimiento
the
para
very year
planificar el
that the
desarrollo
United
en
Nations launched the
observatorioplanificación.cepal.org.
Decade for Action to ignite a more purposeful understanding of the path of the international community towards advancing the 2030 Agenda for Sustainable Development, the world has
Como
confronted
consecuencia de la mayor
unprecedented
pandemia que ha
change in the
vivido el mundo en
specter
los
of
últimos 100
COVID-19.
años, los gobiernos,
The
los organismos
multidimensional
internacionales,
impact of this
la
pandemic
academia, el sector
has
privado y
served to
las
dramatize
organizaciones de la
the true
sociedad
scale
civil
of the
han estado
vulnerability
abocados a
of
la
the
búsqueda de
small,
soluciones y
heavily
alternativas
indebted,
para detener la
undiversified
propagación del
economies of the
COVID-19 y
Caribbean,
afrontar sus
and has
consecuencias
forced
económicas y
creative
sociales.
exploration of every
Entre las medidas
opportunity within the reach
implementadas
of
para
our
frenar y
member states
controlar la
to
propagación
secure
del virus,
urgent relief.
buena parte
The
de los gobiernos de
2020
la
meetings
región
of the
han
Caribbean
optado por el
Development Roundtable
confinamiento de las
and the
personas,
Caribbean Development
decretando
and
cuarentenas
Cooperation
con
Committee
fórmulas
will
diversas.
offer space for taking
Esta
stock of the
situación ha generado no
progress
solo
so
una
far made
contracción
in persuading
considerable
the
de la
international
actividad
community
económica,
to
con
extend
impactos
this financial
diferenciados en la
support
población,
needed.
sino también...
A ver, ahí estoy
Transmitting
transmitiendo en el canal del Twitch, yo estoy transmitiendo en el canal del Twitch y sigo hablando. Eso. Sigo hablando, sigo hablando, sigo hablando. Sigo hablando. Y estoy en... Exactamente, yo estoy en inglés. Exactamente. Y yo estoy escuchándote a ti, no estoy escuchando eso. Voy a cambiar mis audífonos a mis audífonitos regalones. Seguimos, voy a sacar
To support countries in the
mi
follow-up and
superficie,
monitoring of
aunque
the
está
medium
bastante
and
limpiecito.
long-term progress of the crisis caused by COVID-19, the Economic Commission for Latin America and the Caribbean has produced a series of documents on the evolution and the effects of the pandemic in the region. These publications have been included in the COVID-19 Observatory in Latin America and the Caribbean, which compiles and makes available public policies that the 33 countries of Latin America and Caribbean region are taking to limit the impact of the pandemic, as well as the analysis of the economic and social impacts that these policies will have at the national and sectorial levels. ECLAC studies include the collection of special reports COVID-19 that deal with the economic and social effects of the crisis, as well as sectorial publications on specific topics such as the production of statistics, the right to life and health of older people, people with disabilities, the region's food systems, digitization opportunities, the care system, the 2030 Agenda for Sustainable Development in the New Global Context, among other topics. This economic and social analysis will be updated as relevant information related to the COVID-19 pandemic emerges. visit the ECLAC Observatory COVID-19 and access all these reports and updated information on policy measures to face the crisis in the region.
The ESCAZO Agreement is the first regional environmental treaty of Latin America and the Caribbean and offers an unprecedented tool to tackle these challenges. The ESCAZO Agreement contributes to the right to a healthy environment and to sustainable development of present and future generations, guaranteeing access to environmental information, public participation in environmental decision-making, and access to justice in environmental matters. It is the first treaty in the world to protect human rights defenders in environmental matters.
The Regional Conference on Women in Latin America and the Caribbean is the main intergovernmental forum on women's rights and gender equality in the region. The conference, which was established in 1977 as a subsidiary body of ECLAC, is convened on a regular basis to identify the situation of women's autonomy and rights at the regional and sub-regional levels, present public policy recommendations for gender equality, and undertake periodic assessments of the activities carried out in fulfillment of regional and international plans and agreements on the subject.
The Observatory of Social Development in Latin America and the Caribbean is one of ECLAC's regional knowledge tools. Its creation responds to a mandate of the second meeting of the Regional Conference on Social Development of Latin America and the Caribbean, when the member states requested that ECLAC establish an observatory of social development to support the design and implementation of public policies and allow the monitoring of the trends. This way, the observatory promotes the integral development of Latin America and the Caribbean, with a focus on rights and equality through the analysis of the social situation of the region, public policies and technical assistance to the countries that request it. The observatory also integrates a set of digital platforms. The databases are social investment, non-contributory social protection programs, institutional frameworks for social policy, youth and social inclusion, and regional and sub-regional commitments in social development. Through its Social Development Division, ECLAC publishes, updates, and expands these bases, which are available to governments and the general public.
The Statistical Conference of the Americas of ECLAC is a subsidiary body of the Commission, whose mandates include promoting the development and improvement of national statistics and their international comparability. Bearing in mind the recommendations of the United Nations Statistical Commission, the specialized agencies, and other organizations. The mandates of the conference also include the promotion of international, regional, and bilateral cooperation between national offices and international and regional organizations, as well as the preparation of a biennial program of regional and international cooperation activities that, subject to the availability of resources, responds to the demands of the countries of the region. The Strategic Plan 2015-2025 of the conference establishes as main lines of action the institutional strengthening and leadership role of national statistical offices, the development of human resources and statistical production to ensure their quality, and regional and international coordination and cooperation for the development of official statistics in the region. The 10th meeting of the Statistical Conference of the Americas, to be held from the 19th to the 21st November 2019, will bring together authorities and representatives of the national statistical offices and national statistical systems of ECLAC member countries to discuss the future of economic statistics in Latin America and the Caribbean, among other topics.
Exacto, azul
At
marino.
present, Latin America is home to 826 indigenous peoples, which, by the year 2010, included nearly 45 million people, accounting for 8% of the region's population. The countries with the greatest proportion of indigenous peoples are Bolivia, Guatemala, Peru, and Mexico. There is huge diversity among indigenous peoples, with some remaining in voluntary isolation and others coexisting in big cities. Brazil has the greatest amount of indigenous peoples, followed by Colombia, Peru, and Mexico. Indigenous peoples represent one of the most disadvantaged groups in the region and have suffered the systematic loss of their lands, with severe consequences to their well-being. Nevertheless, the Economic Commission for Latin America and the Caribbean, ECLAC, has found some progress in recent years related to the recognition of their territorial rights and political participation. There have also been improvements in their living conditions, with greater access to healthcare and education. The United Nations has championed the promotion of indigenous peoples' rights and relies on 3 special resources for this purpose: a permanent forum, experts, a special rapporteur. At a regulatory level, indigenous peoples are protected by Convention number 169 of the International Labor Organization of 1989, which recognized their rights as peoples for the first time, and the United Nations Declaration on the Rights of Indigenous Peoples of 2007, which considers these peoples' rights to self-determination. In the context of these efforts, ECLAC calls for the region's countries to put policies in practice to end inequality suffered by indigenous peoples. policies based on human rights standards, and the perspectives and contributions of these peoples. This is crucial for the construction of a new development agenda beyond 2015, with equality at its heart.
The SDG Gateway is a web platform that aims to become a key factor for coordination and availability of the regional assets of the United Nations system in Latin America and the Caribbean. The main goal of this online knowledge management center is to serve as a meeting point in reference to all the information related to the sustainable development goals.
Me confirman del vino que está llegando por el principal. Las intérpretes me dicen que sí. Vamos a hablar de un audio de retorno.
Provided by the United Nations Development System in the region. Visit this important multi-stakeholder platform and get to know more about this online regional knowledge management center. The COVID-19 Observatory in Latin America and the Caribbean is a platform promoted by ECLAC at the request of the Community of Latin American and Caribbean States, ECLAC. The observatory tracks the public policies that Latin American and Caribbean countries are implementing to limit the impact of the COVID-19 pandemic in the region.
¿Sí? ¿Me escuchas bien?
Through reports and
Sí, no, yo a ti
documents,
también te escucho,
it
pero
offers analysis of the economic
retorno
and
está
social
llegando.
impacts that these policies will have at the national
Yo
and
tengo acá el audio
sectorial levels,
de la web.
in addition to supporting the review and monitoring in the medium and
Sí,
long
me
term.
está llegando el
In
audio
an
que yo te
interactive
estoy
map,
enviando a ti,
those
me está
interested
llegando por la
can
web.
clearly visualize the actions taken by each country in the areas of movements, health, economy, labor, social protection, education, and gender.
¿Aló?
Visit
¿Aló?
ECLAC's COVID-19 Observatory and
¿Aló?
access updated information on policy measures to address the crisis in the region.
In the very year that the United Nations launched the Decade for Action to ignite a more purposeful understanding of the part of the international community towards advancing the 2030 Agenda for Sustainable Development, the world has confronted unprecedented change in the specter of COVID-19. The multi-dimensioned impact of this pandemic has served to dramatize the true scale of the vulnerability of the small, heavily indebted, undiversified economies of the Caribbean, and has forced creative exploration of every opportunity within the reach of our member states to secure urgent relief. The 2020 meetings of the Caribbean Development Roundtable and the Caribbean Development and Cooperation Committee will offer space for taking stock of the progress so far made in persuading the international community to extend this financial support needed, middle income status notwithstanding, and to dialogue on those strategies that will take you from vulnerability to resilient development, from economic peril to recovery and dynamic growth. It is an opportunity to consider how together we strengthen partnerships for action that is responsive to the unique vulnerabilities of the Caribbean, and that assures tangible progress through the application of innovative problem solving in these precarious times.
To support countries in the follow-up and monitoring of the medium and long-term progress of the crisis caused by COVID-19, the Economic Commission for Latin America and the Caribbean has produced a series of documents on the evolution and the effects of the pandemic in the region. These publications have been included in the COVID-19 Observatory in Latin America and the Caribbean, which compiles and makes available public policies that the 33 countries of Latin America and Caribbean region are taking to limit the impact of the pandemic, as well as
Sala de control, alguien está escuchando arriba.
that these policies will
Pedro,
have and sectorial levels. ECLAC
Pedro y
studies
Alejandro,
include a
los dos, si
collection
pueden
of
bajar ahora, por
special
favor.
reports COVID-19 that deal with the economic and social effects of the crisis, as well as sectorial publications on specific topics such as the production of statistics, the right to life and health of older people, people with disabilities, the region's food systems, digitization opportunities, the care system, the 2030 Agenda for Sustainable Development in the New Global Context, among other topics. This economic and social analysis will be updated as relevant information related to the COVID-19 pandemic emerges. Visit the ECLAC Observatory COVID-19 and access all these reports and updated information on policy measures to face the crisis in the region.
The Escazú Agreement is the first regional environmental treaty of Latin America and the Caribbean and offers an unprecedented tool to tackle these challenges. The Escazú Agreement contributes to the right to a healthy environment and to sustainable development of present and future generations, guaranteeing access to environmental information, public participation in environmental decision-making, and access to justice in environmental matters. It is the first treaty in the world to protect human rights defenders in environmental matters.
Probando audio, 1, 2, 3, 1, 2, 3, 1, 2, 3, probando audio. ¿Todo bien? Confírmenme.
Todo bien, profesor. Escucho súper bien. Gracias a ti.
The Regional Conference on Women in Latin America and the Caribbean is the main intergovernmental forum on women's rights and gender equality in the region. The conference, which was established in 1977 as a subsidiary body of ECLAC, is convened on a regular basis to identify the situation of women's autonomy and rights at the regional and sub-regional levels, present public policy recommendations for gender equality, and undertake periodic assessments of the activities carried out in fulfillment of regional and international plans and agreements on the subject.
The Observatory of Social Development in Latin America and the Caribbean is one of ECLAC's regional knowledge tools. Its creation responds to a mandate of the second meeting of the Regional Conference on Social Development of Latin America and the Caribbean, when the member states requested that ECLAC establish an Observatory of Social Development to support the design and implementation of public policies and allow the monitoring of the trends. This way, the Observatory promotes the integral development of Latin America and the Caribbean with a focus on rights and equality through the analysis of the social situation of the region, public policies and technical assistance to the countries that request it. The Observatory also integrates a set of digital platforms. The databases are social investment, non-contributory social protection programs, institutional frameworks for social policy, youth and social inclusion, and regional and sub-regional commitments in social development. Through its Social Development Division, ECLAC publishes, updates, and expands these bases, which are available to governments and the general public.
The Statistical Conference of the Americas of ECLAC is a subsidiary body of the Commission, whose mandates include promoting the development and improvement of national statistics and their international comparability. Bear in mind the recommendations of the United Nations Statistical Commission, the specialized agencies, and other organizations. The mandates of the conference also include the promotion of international, regional, and bilateral cooperation between national offices and international and regional organizations, as well as the preparation of a biennial program of regional and international cooperation activities that, subject to the availability of resources, responds to the demands of the countries of the region. The Strategic Plan 2015-2025 of the conference establishes as main lines of action the institutional strengthening and leadership role of national statistical offices, the development of human resources and statistical production to ensure their quality, and regional and international coordination and cooperation for the development of official statistics in the region. The 10th meeting of the Statistical Conference of the Americas, to be held from the 19th to the 21st November 2019, will bring together authorities and representatives of the national statistical offices and national statistical systems of ECLAC member countries to discuss the future of economic statistics in Latin America and the Caribbean, among other topics.
At present, Latin America is home to 826 indigenous peoples, which, by the year 2010, included nearly 45 million people, accounting for 8% of the region's population. The countries with the greatest proportion of indigenous peoples are Bolivia, Guatemala, Peru, and Mexico. There is huge diversity among indigenous peoples, with some remaining in voluntary isolation and others coexisting in big cities. Brazil has the greatest amount of indigenous peoples, followed by Colombia, Peru, and Mexico. Indigenous peoples represent one of the most disadvantaged groups in the region and have suffered the systematic loss of their lands, with severe consequences to their well-being. Nevertheless, the Economic Commission for Latin America and the Caribbean, ECLAC, has found some progress in recent years related to the recognition of their territorial rights and political participation. There have also been improvements in their living conditions, with greater access to healthcare and education. The United Nations has championed the promotion of indigenous peoples' rights and relies on 3 special resources for this purpose: a permanent forum, experts, a special rapporteur. At a regulatory level, indigenous peoples are protected by Convention number 169 of the International Labor Organization of 1989, which recognized their rights as peoples for the first time, and the United Nations Declaration on the Rights of Indigenous Peoples of 2007, which considers these peoples' rights to self-determination. In the context of these efforts, ECLAC calls for the region's countries to put policies in practice to end inequality suffered by indigenous peoples. Policies based on human rights standards and the perspectives and contributions of these peoples. This is crucial for the construction of a new development agenda beyond 2015, with equality at its heart.
The SDG Gateway is a web platform aiming to become a key factor for coordination and availability of the regional assets of the United Nations system in Latin America and the Caribbean. The main goal of this online knowledge management center is to serve as a meeting point and reference to all the information related to the Sustainable Development Goals, including activities, informational resources, statistics, regional data, specific analytic tools, and knowledge products developed and provided by the United Nations Development System in the region in response to its member countries. Visit this important multi-stakeholder platform and get to know more about this online regional knowledge management center. The COVID-19 Observatory in Latin America and the Caribbean is a platform promoted by ECLAC at the request of the Community of Latin American and Caribbean States, ECLAC. The observatory tracks the public policies that Latin American and Caribbean countries are implementing to limit the impact of the COVID-19 pandemic in the region. Through reports and documents, it offers analysis of the economic and social impacts that these policies will have at the national and sectorial levels, in addition to supporting the review and monitoring in the medium and long term. In an interactive map, those interested can clearly visualize the actions taken by each country in the areas of movements, health, economy, labor, social protection, education, and gender. Visit ECLAC's COVID-19 Observatory and access updated information on policy measures to address the crisis in the region.
In the very year that the United Nations launched the Decade for Action to ignite a more purposeful understanding of the part of the international community towards advancing the 2030 Agenda for Sustainable Development, the world has confronted unprecedented change in the specter of COVID-19. The multi-dimensioned impact of this pandemic has served to dramatize the true scale of the vulnerability of the small, heavily indebted, undiversified economies of the Caribbean, and has forced creative exploration of every opportunity within the reach of our member states to secure urgent relief. The 2020 meetings of the Caribbean Development Roundtable and the Caribbean Development and Cooperation Committee will offer space for taking stock of the progress so far made in persuading the international community to extend this financial support needed, middle income status notwithstanding, and to dialogue
Se está viendo negro
that
acá.
will take you
Se
from
está viendo negro.
poverty to resilient development, from economic peril to recovery and dynamic growth. It is an opportunity to consider how together we
La
strengthen
original no se
partnerships
puede.
for action that is responsive to the unique vulnerabilities of the Caribbean, and that assures tangible progress through the application of innovative problem solving in these precarious times.
To support countries in the follow-up and monitoring of the medium and long-term progress of the crisis caused by COVID-19, the Economic Commission for Latin America and the Caribbean has produced a series of documents on the evolution and the effects of the pandemic in the region. These publications have been included in the COVID-19 Observatory in Latin America and the Caribbean, which compiles and makes available public policies that the 33 countries of Latin America and Caribbean region are taking to limit the impact of the pandemic, as well as the analysis of the economic and social impacts that these policies will have at the national and sectorial levels. ECLAC studies include a collection of special reports COVID-19 that deal with the economic and social effects of the crisis, as well as sectorial publications on specific topics such as the production of statistics, the right to life and health of older people, people with disabilities, the region's food systems, digitization opportunities, the care system, the 2030 Agenda for Sustainable Development in the New Global Context, among other topics. This economic and social analysis will be updated as relevant information related to the COVID-19 pandemic emerges. Visit the ECLAC Observatory COVID-19 and access all these reports and updated information on policy measures to face the crisis in the region.
The Escazú Agreement is the first regional environmental treaty of Latin America and the Caribbean and offers an unprecedented tool to tackle these challenges. The Escazú Agreement contributes to the right to a healthy environment and to sustainable development of present and future generations, guaranteeing access to environmental information, public participation in environmental decision-making, and access to justice in environmental matters. It is the first treaty in the world to protect human rights defenders in environmental matters.
The Regional Conference on Women in Latin America and the Caribbean is the main intergovernmental forum on women's rights and gender equality in the region. The conference, which was established in 1977 as a subsidiary body of ECLAC, is convened on a regular basis to identify the situation of women's autonomy and rights at the regional and sub-regional levels, present public policy recommendations for gender equality, and undertake periodic assessments of the activities carried out in fulfillment of regional and international plans and agreements on the subject.
The Observatory of Social Development in Latin America and the Caribbean is one of ECLAC's regional knowledge tools. Its creation responds to a mandate of the second meeting of the Regional Conference on Social Development of Latin America and the Caribbean, when the member states requested that ECLAC establish an Observatory of Social Development to support the design and implementation of public policies and allow the monitoring of the trends. This way, the Observatory promotes the integral development of Latin America and the Caribbean with a focus on rights and equality through the analysis of the social situation of the region, public policies and technical assistance to the countries that request it. The Observatory also integrates a set of digital platforms. The databases are social investment, non-contributory social protection programs, institutional frameworks for social policy, youth and social inclusion, and regional and sub-regional commitments in social development. Through its Social Development Division, ECLAC publishes, updates, and expands these bases, which are available to governments and the general public.
The Statistical Conference of the Americas of ECLAC is a subsidiary body of the Commission, whose mandates include promoting the development and improvement of national statistics and their international comparability. Bearing in mind the recommendations of the United Nations Statistical Commission, the specialized agencies, and other organizations. The mandates of the conference also include the promotion of international, regional, and bilateral cooperation between national offices and international and regional organizations, as well as the preparation of a biennial program of regional and international cooperation activities that, subject to the availability of resources, responds to the demands of the countries of the region. The Strategic Plan 2015-2025 of the conference establishes as main lines of action the institutional strengthening and leadership role of national statistical offices, the development of human resources and statistical production to ensure their quality, and regional and international coordination and cooperation for the development of official statistics in the region. The 10th meeting of the Statistical Conference of the Americas, to be held from the 19th to the 21st November 2019, will bring together authorities and representatives of the national statistical offices and national statistical systems of ECLAC member countries to discuss the future of economic statistics in Latin America and the Caribbean, among other topics.
At present, Latin America is home to 826 indigenous peoples, which, by the year 2010, included nearly 45 million people, accounting for 8% of the region's population. The countries with the greatest proportion of indigenous peoples are Bolivia, Guatemala, Peru, and Mexico. There is huge diversity among indigenous peoples, with some remaining in voluntary isolation and others coexisting in big cities. Brazil has the greatest amount of indigenous peoples, followed by Colombia, Peru, and Mexico. Indigenous peoples represent one of the most disadvantaged groups in the region and have suffered the systematic loss of their lands, with severe consequences to their well-being. Nevertheless, the Economic Commission for Latin America and the Caribbean, ECLAC, has found some progress in recent years related to the recognition of their territorial rights and political participation. There have also been improvements in their living conditions, with greater access to healthcare and education. The United Nations has championed the promotion of indigenous peoples' rights and relies on 3 special resources for this purpose: a permanent forum, experts, a special rapporteur. At a regulatory level, indigenous peoples are protected by Convention number 169 of the International Labor Organization of 1989, which recognized their rights as peoples for the first time, and the United Nations Declaration on the Rights of Indigenous Peoples of 2007, which considers these peoples' rights to self-determination. In the context of these efforts, ECLAC calls for the region's countries to put policies in practice to end inequality suffered by indigenous peoples. Policies based on human rights standards and the perspectives and contributions of these peoples. This is crucial for the construction of a new development agenda beyond 2015, with equality at its heart.
The SDG Gateway is a web platform aiming to become a key factor for coordination and availability of the regional assets of the United Nations system in Latin America and the Caribbean. The main goal of this online knowledge management center is to serve as a meeting point and reference to all the information related to the Sustainable Development Goals, including activities, informational resources, statistics, regional data, specific analytic tools, and knowledge products developed and provided by the United Nations Development System in the region in response to its member countries. Visit this important multi-stakeholder platform and get to know more about this online regional knowledge management center. The COVID-19 Observatory in Latin America and the Caribbean is a platform promoted by ECLAC at the request of the Community of Latin American and Caribbean States, ECLAC. The observatory tracks the public policies that Latin American and Caribbean countries are implementing to limit the impact of the COVID-19 pandemic in the region. Through reports and documents, it offers analysis of the economic and social impacts that these policies will have at the national and sectorial levels, in addition to supporting the review and monitoring in the medium and long term. In an interactive map, those interested can clearly visualize the actions taken by each country in the areas of movements, health, economy, labor, social protection, education, and gender. Visit ECLAC's COVID-19 Observatory and access updated information on policy measures to address the crisis in the region.
In the very year that the United Nations launched the Decade for Action to ignite a more purposeful understanding of the part of the international community towards advancing the 2030 Agenda for Sustainable Development, the world has confronted unprecedented change in the specter of COVID-19. The multi-dimensioned impact of this pandemic has served to dramatize the true scale of the vulnerability of the small, heavily indebted, undiversified economies of the Caribbean, and has forced creative exploration of every opportunity within the reach of our member states to secure urgent relief.
Muy buenos días.
Good morning and good afternoon. Thank you to everyone who is joining us here today on this occasion from the offices of ECLAC in Santiago. We will be presenting the social outlook for 2021. We are broadcasting via Zoom from ECLAC as well as on live.cepal.org as well as on Twitter, YouTube, and Facebook. We are also transmitting and broadcasting again on the website of ECLAC at www.cepal.org. We greet particularly all of the journalists who have registered to participate in this launch, as well as our colleagues from the organization throughout the Americas who are joining us in this live broadcast. The presentation of this document will be made by Alicia Bárcena, the Executive Secretary of ECLAC, and she will be sharing the primary conclusions from the report. Subsequently, we will open up to a Q&A session in a press conference format. We would ask that the media please present to us in advance to the extent possible their questions by by email at conferenciadeprensa.cepal.org or via the Zoom chat. For these purposes, we are going to turn the floor over to the Executive Secretary, Alicia Bárcena of ECLAC. Good morning, everyone. It is a pleasure to be here and join you today. Of course, I will be making a presentation as we normally do, but I would first like to thank the entire team that has participated in preparing this. And I want to thank Simone Echekini, our Social Affairs Officer from the Social Development Division, who is the officer who has been responsible for considerable time for this and was responsible for preparing the report in conjunction with a very competent team that I might mention briefly because it is important to acknowledge who is behind this report. Simone, Carlos Maldonado, Daniela Tuco, Claudia Robles, Malu Mariño, Ernesto Espíndola, Bernardo Beatesta, Beatriz Morales, of the Social Division. But please also note that in this, we also have the Statistic Division, and we have Rolando Campo, Director of the Statistics Division, with us, with a very complete team as well, and that is led by Alvaro Fuentes and Javier Mancero. We also have the Director of Gender Affairs, Ana Westmes, who in conjunction with others in their office have done a spectacular job in presenting this. And we have Pablo Usad from CELADE, who also participated quite actively with his team. I'm also very pleased to note that we have Alberto Arenas, who starting March 1st will be responsible for the Social Division. So if you give me just a moment, I am going to move to a new position and we will get started.
Bueno, muchas gracias.
Thank you very much. It is a pleasure to be here. I must, of course, recognize Mario Timolim, Assistant Secretary, Executive Secretary of the Economic Commission for Latin America and the Caribbean, very important in this preparing this, as well as our press division and others. It is a collective effort, of course. And why is what we're going to be presenting today so important? Because it is an analysis that is not just the annual vision of what we do within the organization, but it's also an outlook, a vision, an opportunity as well to look at what has happened in the context of this pandemic and the impact that this has had across our region. So firstly, as we've said in previous reports, and I want to stress this, of course, the pandemic has expanded on poverty, informality, and other underlying conditions. The region had been experiencing 7 years of low growth. We talk about a lost decade, in fact, with increasing poverty and growing social tensions. The pandemic also deepened structural inequalities with very high levels of informality. Of course, these existed previous to the pandemic, but they were expanded as a result of the pandemic, along with a lack of social protection, low productivity, exposing critical nodes in health, education, and care. It also magnified the very much unjust sexual division of labor and the social organization of caregiving. For women particularly, it has been a tough time, and we've seen a setback of a decade in the inclusion of women in the labor market. It has been a tremendous impact. We had made progress, slow progress, but nonetheless some progress. And nonetheless, we're seeing a decade-long setback in this inclusion of women. We've also seen that there's been an unequal impact on informal workers and young people, as well as we will see in the course of this outlook. We can also stress that public policies are needed to address the pandemic, and particularly to connect this emergency with a new form of recovery. We don't want to go back to where we were, but rather we want a transformative recovery with equity and sustainability. We know, of course, that we are not yet in the recovery phase because a number of countries, of course, are still in the response phase to the emergency, but we do need to find a way to connect these two phases, and this can only be done through public policy. We at ECLAC are also underscoring the urgent need to move toward a welfare state with universal, comprehensive, and sustainable social protection systems. And toward that, we need to have a new social compact. Within this outlook, therefore, we have 6 fundamental messages that we want to address. First, and here is, I think, the novelty. I think that this is the only document, at least that I'm familiar with, in which we are doing an analysis 1 year out after COVID-19. So 1 year after patient 0 was identified in our region, this is the outlook. Now, obviously, the 7.7 drop in GDP, the closure of 2.7 million companies, and very high rates of unemployment with sharp gender labor gaps is a particular concern. Secondly, we need to understand that our region is the hardest hit developing region because although we only have 8.4% of the world's population, the region has recorded 27.8% of COVID-19 deaths. Governments in the region, of course, have reacted, and in the report, we have analyzed 263 social protection measures designed to address the crisis. Of course, we acknowledge the tremendous efforts have been made, but we do see that they covered nearly 50% of the population. With estimated additional emergency spending between March and December of 2020, an effort has clearly been made to include an additional $86 billion. Fourth, the social protection measures have prevented a further increase in poverty and extreme poverty, despite the fact that there has been a 12-year setback in poverty and a 20-year setback in extreme poverty. We will be looking at that in greater detail. Another aspect that we are looking at, something that is provides continuity to the previous social outlook, has to do with the increase in vulnerability as compared to 2019. We were at 467 million people in 2019, and that has risen to 491 million people who are living on incomes up to 3 times the poverty line. This means that we need, therefore, to consider, we're talking here about 8 out of every 10 Latin Americans. And this leads us to think seriously about the importance of universal policies, but also the need to generate employment. Now, in 2021, and we are saying this clearly and strongly, we will need to see the emergency cash transfers maintained to cover basic needs and to support recovery. In truth, in this report, we have looked at the critical nodes or the bottlenecks at the area of times of this pandemic. And when we talk about these bottlenecks or critical points, we're talking about 3 real areas, such as healthcare, education, and caregiving in general. And we'll look at why the region is the hardest hit, what the risk factors are that lead to this situation, the population density, overcrowding, and so forth. The closing of schools, of course, has also generated tremendous inequality, as well as the overburdening of women, specifically for unpaid care work. So on this note, I would like to share with you some information that I think is vital. As I noted, our region has 8.4% of the world's population, but nonetheless, we've recorded 27.8% of all deaths as a result of COVID-19. And this is due to several reasons. We're talking about a population of 654 million people. We've had deaths of 507,000 per million. Now, the question is, why has this been the case? In Latin America and the Caribbean, we can see, of course, that this is the most highly urbanized region in the world. 81% of the population and 35%, 81% even live in cities, and 35% live in a metropolis of at least 1 million inhabitants. So what are we grappling with in Latin America? Overcrowding and lack of access to basic services. In this context, therefore, social protection for the impoverished population is a delicate topic and is certainly, obviously, the population that is the neediest, and they also tend to present comorbidities. They are those who suffer from malnutrition, those who suffer from obesity or diabetes, and so forth. And therefore, unfortunately, this is concentrated primarily in the most vulnerable people.
Fragmentados. The region also has unequal, underfunded systems that have poor infrastructure. And the other major issue is that there's a slow access to inoculation, vaccination. And I will delve into that later on. So overcrowding affects 55% of the urban households living in poverty. We can see, and this is what the figure shows, 55% or more of the poor urban households house 2 or more individuals in one single room. Now that is the information we have available to us. And we have also seen that more than a third of the urban households house 3+ individuals in a single room. Now, this is a very sensitive situation, and this is what we have observed. We have seen that in this sector of extreme poverty, we have a great deal of overcrowding. And obviously, in an overcrowded situation, it's very difficult to prevent infection of COVID and other. Anyhow, we have seen that one of the worst issues, and this is a very detailed report, by the way, I hope you have the opportunity to peruse it with a great deal of care, but we have seen that during the peak times of this pandemic, the situation was quite serious, particularly toward the end of last year. And we have seen that 167 million students saw that their educational establishments were shut down. Now, today, this figure is 121 million, which is still an alarming figure because there's a great deal of uncertainty regarding the opening or not of the schools. And this is an issue, of course, but there's another issue, major issue, I think that is worth mentioning. You can see here on the figure, we have the number of students whose schools have shut down. And this is also information broken down by country. At the peak, there were 32 out of the 33 countries that have closed down their schools. And today, 11 countries have closed their schools. But by the way, there's still a great deal of uncertainty regarding the new wave of infection and many other aspects. So also, we can see here that we measure the countries that have partially opened their schools. Now, what's important here is that 121 million students have been impacted here. And on the right, we can see the figure showing something also of a significant concern. There's a very wide divide with regard to access to internet for children aged 5 to 12. You can see in the first quintile, let me refer to Colombia specifically because Argentina has a divide, obviously, but in the poorest quintile, 9.7% of the children ages 5 to 12 do not have access to internet. But look at El Salvador, 95%. Mexico is worse. And the wealthiest quintile in the case of Mexico is 18.4%. So you can see the gap, 88 versus 18, 97 versus 34, and then Colombia 79, practically 80 versus 5.6. And as a result, well, here I am referring to I'm just referring to the broad strokes of the major issues that we have had to face during the pandemic. Now, let us take a peek at the situation prior to the pandemic, when the pandemic hit. Now, why have we said that structural problems have been magnified? Well, because we were already undergoing an interesting trend in which we saw that poverty and extreme poverty were on the rise. We had already experienced high levels of poverty in the rural regions, in the peasant regions, indigenous regions, and we saw that the Gini was already stagnant, and this was prior to the pandemic, and we had already been facing a high level of informality in the labor sector and a great deal of gender inequality as well on the job, specifically with regard to unpaid work. So from 2014 to 2018, and by the way, 2019, and right here I'm referring to how we are able to control the pandemic. I just wanted to underscore that. From 2014 to 2019, we were, well, from 2012 to 2014, we had been able to drop poverty rates, extreme poverty rates, but from 2014 onward, we started observing and measuring, because that's what we do at ECLAC, because these are ECLAC measurements, we started to see that poverty and extreme poverty was on the rise from 2014 to 2019. And you can see the increase here, and in terms of millions of individuals, 162 to 187 million from 2014 to 2019. And extreme poor, we have 7.8 in 2014 and 11.3 in 2019. Now, this translates into 46 million individuals in 2014 to 70 million people in 2019. So we are witnessing a situation in which poverty and primarily extreme poverty are on the rise. Now, with regard to the poverty gap, we have seen that these are more pronounced. These major gaps are more pronounced in the rural regions. Rural poverty is 46.7%, 45.7% when compared to urban poverty, and extreme poverty in the rural area is 21.2 compared to 9% in the rural area. So here we can see that this situation is the urban-rural gap is quite challenging, but there are other divides and gaps that we should also be concerned with. For example, children from age 0 to 14 has a poverty of 47% and extreme poverty of 19.6%. Now, with regard to other age groups, for example, we can see where, fortunately, the 65 and older are doing better, but the situation regarding children is quite alarming. Supposedly they're a future, but they're living in these conditions. And of course, this is even worse in the indigenous community, 46.7% regarding the non-indigenous, with non-indigenous, and then of course the Afro-descendants. These are the two major groups that have been significantly hit with this. And let's look at another figure here that is quite alarming. You can see poverty of individuals who were unable to finish primary school. 38.5% of them live in poverty, those who have not finished primary school. This is extremely grave. And let's look at tertiary or upper education, higher education, 3.9 live in poverty, 1.6 in extreme poverty. But what is most alarming are the figures related to those who have not finished primary school. They live in a very difficult situation. Now, with regard to Gini, this is how we measure income inequality. This was stagnant from 2017 to 2019. And this is extremely alarming because if it was stagnant during that period, what should we expect for the future? Let's take a peek here at these figures from 2012 to 2014, there was a 0.53, 0.46% drop, and in 2019, it has once again remained stagnant. 0.46. That's where we have remained. But let's wait and see what will occur after the pandemic. And also, and this right here is extremely concerning, and ECLAC has been emphasizing this for decades now. We see that there continues to be a high level of low productivity in certain sectors. We have not seen any change here. In some cases, the situation is worsening, but this is the situation. There are many sectors with low productivity. This results in informality and low salaries. And here we actually are showing the individuals who are in low productivity sectors, working in low productivity sectors. Now, we are always breaking down all of our data and figures by gender, men and women, and we see that there's a significant percentage, 39.7%, practically half, corresponds to both sexes in working in low productivity systems. And then we have the percentage of individuals in a pension system. There's a large percentage of them outside, and they're not involved in the pension system. They're not receiving or contributing to any pension. And that is the situation. And the rest of these individuals are not engaged in any pension system. They obviously are the poorest individuals, 8% in the first decile, 18% in the second decile, and on average, we see that there's an increase here. This trend is on the rise. So this is a situation, individuals who are not members of any pension system, they're not signed up, they're not receiving any benefits. And this is extremely concerning because I showed you that the children and adolescents are the age groups that are most affected by poverty, and a third of the households with boys, girls, and adolescents are not covered by any type of social service. 33.4% is the average of the households that do not have any social protection mechanism. And obviously, we have this mixed type of protection systems in some countries, but let's look at Honduras. Honduras is extremely concerning. We can see that 72.2% of the boys, girls, and adolescents are not covered by any type of social protection system. And I think this is something that we need to underscore. 31%, that is the yellow bar, refers to those who have access through a contribution-based system. 19% is blue, refers to those who have access through a non-contributive type system, and the rest in part of a mixed protection system. And that is the status quo. Our future boys, girls, and adolescents, they are unprotected. And here we can also see that more than 30% of poor women are not involved in the labor market because of family reasons. Now, this is a survey that actually reflects only one single dimension of the care economy. There are many other dimensions of the care economy that explain why women are not involved in the labor market. But in this specific case, we are measuring when the reason is for family reasons. Well, let's now take a peek at the care economy. In all the countries, the poorest quintile is the quintile that has to spend most of its time on the unpaid care economy, and as a result, they are unable to be engaged in the labor market. Women up to age 50 roughly who cannot work in the labor market because of family reasons. They need to remain at home because they have children, boys, girls, or elderly or disabled individuals living at home that require their care. And this is something that occurs much more in the poorer households. Look at the greenish blue bar. That clearly shows how, in practically all of the countries across the board, with just a few exceptions, we can see that roughly the percentage of women involved in this sector is 30%. Now, what happened during the pandemic? Now, I was just referring to the situation we were experiencing when the pandemic hit. Now, let me refer to following after the pandemic. So now before and now we're doing with the after. We have seen that employment obviously is the master key for leaving poverty and inequality behind. But let's focus on what happened here. We have seen that the unemployment rate has increased. We have also seen that women, primarily women, but most people had, actually many people had stopped looking for work. And now we have seen that the situation has greatly affected young people and the informal economy. And now we have seen that many women working in paid domestic work have also been affected. There's more unemployment there, and they were the bastion of that sector, of the informal sector. And we can see that there's higher degree of vulnerability as well, and a social mobility is on a downward trend. Now let's look at the impact of the crisis on the labor market. Now, obviously, we have measured the number of individuals in the labor market per country and how this has dropped. Obviously, these figures show that women have been more affected than men. These figures confirm that. This information comes from 12 countries, and that is worth mentioning. And what we're measuring here is how we have seen a contraction, a shrinking of the labor population from January to June in 2020, comparing that same time frame to 2019. So we're measuring April, June 2020 to April, June 2019. Those are the months. And with regard to this information, we can see, for example, Peru. What are we showing here? We are showing the drop in employed individuals. Peru, for example, we see that 39.5% fewer employed individuals. And how was this distributed? And this is where we see the end all be all of the situation.
I would say that it's not excellent, but the situation for men is not that bad. But if you look at women, we can specifically see this. Now, we can also note that in general, in all of the countries, the groups that are hardest hit are the women, and particularly we have very important gaps, as I've already highlighted, specifically in Peru. But if you look at the case of Costa Rica, which is also a very clear case where we've seen a reduction in employment, but for women, it is significantly greater than it is for men. So Costa Rica, Colombia, and so forth. We absolutely need to look at Mexico, of course, where we can see that this variation in the employed population affected women much more severely than men. We've also seen with considerable concern the important reduction in people in the workforce. We've seen that the unemployment rate reached 10.7% in 2020. That's an increment of 2.6 percentage points over the level recorded in 2019. And importantly, only 21.3 of the employed people in the region, those who are still employed, are able to perform telecommuting work. Everyone else cannot, and that is a substantive issue that we've also addressed in other documents, which is this huge gap that workers also confront. We can also see how the reduction in employment has affected particularly informal workers and young people. The strongest impact that we can see here is the impact again on employment overall, but if we look at those that are hardest hit, we can see the participation of informal workers. If we look at this, for example, just to use in a different country as an example, Argentina. of the total amount of employment loss, 53% belonged or correspond to informal workers. That is to say that the biggest loss in the region in terms of employment comes precisely among informal workers. So in Argentina, of the total number of jobs lost, 53% were informal, and we see even higher levels in Brazil, Costa Rica, Mexico, Paraguay, and the Dominican Republic. We can see that these are the groups that have, again, been hardest hit. If we look at Costa Rica, Brazil specifically, we can see that 3 out of every 4 jobs are informal. If we look at the bottom of the screen, we can see the informal employment rate in 2019 versus 2020. But most important, perhaps, is to note that the informal workers and their participation in the workforce is important. In other words, informal employment is no longer that safeguard. Today, people moved from the formal market into the informal market, but today that market has collapsed as well. So what is to be done and where are they going to go is the question. And what we see quite clearly here are the individuals who are between 14 and 18 years of age. Young people, with one single exception, were those who were hardest hit were over the age of 60. But in every other country, we can see very clearly that, again, by age group, those hardest hit were young people. If we are looking at inequality, we can see 2 very important variables. One is employment and the variation in labor income. If we look at the slides that we have the average variation of unemployment, as we said, 2.6 percentage points. But if we look at that in terms of unemployment, we can see that the highest unemployment rates occur particularly in the poorest of homes. So 20% of unemployed persons are in the poorest quintiles. We can also see that between 2019 and 2020, there is a difference of over 5%. And when we look at the richest quintile, that variation was 0.7%. Obviously, the biggest losers, as always, are the poor. On the right-hand side of this screen, we can see the drop in the average variation of labor income. This is, again, in keeping with the poverty line. And we can see that in 2019, we saw a drop across all of the quintiles. No one escaped this issue, but in general, we saw an average of about 15%. But those, again, who were most affected were -7, which is an impact, of course. But when we look at what was lost by the poorest quintiles, we were talking about 42.2%. So what was lost, the average variation in income was -15, but the poor, it's -42%. That is a huge difference. Another thing that is important is vulnerability. This is something that we've referred to in other outlooks, and this has to do with social mobility. We could see that in Latin America, 491 million people were living on incomes up to 3 times the poverty line. That is to say, 8 out of every 10 Latin Americans are vulnerable, 79%, but it's 8 out of every 10 Latin Americans that face tremendous vulnerability, and therefore we absolutely need universal social protection systems. If we look at women, Specifically, and this is a topic of tremendous concern because the backsliding in the working conditions of women was specifically in the question of paid domestic work. This is where 76% of women in paid domestic work do not have a pension coverage. That is to say, they have no support system, they have no unemployment insurance, they have no pension, they don't have access to healthcare, and this is of the utmost importance. And we can see how domestic employment, paid domestic employment, deteriorated in the different countries. In Chile, between May and July of 2020, the drop was 46.3% in the sector of households as employers. In other countries, it's measured as occupation in domestic employment, such as Colombia, Costa Rica, measures the household sector as employers, just like in Chile. So in any case, but based on this, we can see that paid domestic work of women, again, has been one of the hardest hit fields during the pandemic. So then what have the countries done and what impact has there been? We all know that countries are taking measures and doing things, but what is important in this panorama is what is the impact of those measures been? What has been the result of these measures vis-a-vis poverty and extreme poverty? And we can see that countries have taken substantive measures. We have 263 emergency social protection measures that have been implemented, the spending announced of 86 billion, equivalent to 1.25% of Latin American GDP and the Caribbean, which covers some 49.4% of the regional population, including many informal workers. Of course, as we noted, they were among the hardest hit. But we're also seeing in this outlook that the amounts of the cash transfers have been insufficient to cover basic needs because they are not bringing people up to the poverty line. And that is the crux of the issue. We're also seeing clearly that these emergency transfers nonetheless have contributed to slowing the deterioration of poverty, but they have not fully contained it, and that is precisely what we want to show now. Another thing that I must highlight is that the main spending of central government has been directed to social spending. This is important because if we look at what was happening in the year 2000, if social public spending as a percentage of GDP was 8.5%, and social spending as the percentage of the total spending was just over 46%. And in 2019, it had risen to just over 52%. In Latin America, it's clear there has been an effort to increase government social spending. We don't have the exact figures for 2020. We hope to have them soon. But in the case of the Caribbean, we've also seen an effort to increase these figures, referring to social public spending, as we can see on screen. So there are efforts throughout the region to increase and to bolster that social spending. I do want to spend a bit of time on this slide because here is where we find that description of those 263 emergency social protection measures. If we look at these, and we can see that 56% of these measures were monetary transfers. We looked at 147 measures in 30 countries. We do this through our COVID-19 observatory and our social observatory, and we've continued to track this. And this is what we had agreed to look at, the measures that have been taken, and what sort of impact they have had. We'll turn to that in just a moment. But the first thing I want to look at is that 156% of measures were monetary in nature. We can see this in the pie chart. And we can also see that there have been 29 countries implemented 100 new transfers. New transfers mean an innovation, innovating in terms of who they're reaching out to with these. 11 countries increased existing amounts, So what we're seeing, we've seen again an increase in 11 countries in terms of the amount, 9 countries increased coverage, and 9 countries also provided an early or anticipated delivery of existing programs. And on the other side of the pie, we're showing what has been done in basic services and in the provision of medication and other key aspects. This is particularly very important when people are being provided food in kind and medication. Now, in 2020, cash and in-kind transfers were announced to the amount of $86 billion. What we're looking at here is the distribution in total percentages of current dollars that have been invested. If we look at these 86 billion across the region, some 85 billion correspond to Latin America. 76 are within South America, Central America, Mexico, Haiti, Dominican Republic, 9.4 million, and in the Caribbean, 233,000. So if we look at this, we can see how each of these transfers, emergency monetary transfers, worked, both again, cash and in-kind transfers were analyzed. We can see how Latin America has made tremendous efforts and South America has as well. Certainly, the biggest portion of the pie has been distributed in South America. If we look at the per capita announced emergency transfers, we can see that in Latin America, or if we're looking at Latin America overall versus South America, and again, we need to be looking at this very carefully. This is an average estimated expenditure, because someone will always say, hey, I didn't get that. No, this is an average. And it's very important to say this, but it does give us an idea of how the support, this emergency support, has been handled. Now, these emergency measures represent 1.25% of GDP, referring to all of Latin America and the Caribbean. And just in Latin America, these measures announced are equivalent to 1.55% of GDP. And we can see how important this is. This is 2.3 times the average annual spending of countries with CTPs, of the conditional transfer programs, and non-contributory pensions. That is 2.3 times more is what the region has been contributing in Latin America. In Central America, Mexico, Haiti, and the Dominican Republic, commitments are 4.1 times the 2018 average spending on CTP and contributory pensions. So we can see here how this has had an impact in terms of COVID measures in Latin America. We can see 1.32 in Central America, Haiti, and Dominican Republic, and the other figures we can see on screen in terms of COVID measures versus FTE and social pensions in 2018 and 2019. And we can see how this has been applied. Again, we are calculating this on the basis of 2019 numbers.
In-kind monetary transfers have reached 49% of the population, 49.4%. And this is key because these measures have been essential, critical for many families. What we can see here is that individuals in households receiving the in-kind monetary transfers and program, 49.4% of the households in the region have benefited from this. 60.8 in Latin America, 66.1 in South America, 54.2 in Central America, Mexico, Haiti, in the Dominican Republic, and 31.5 in the Caribbean. Now, this is essential because what we're saying is that, first of all, this is an estimated population of 66.8% in Latin America, rather 60.8% in all Latin America, and 40.3% more coverage than the ongoing permanent in-kind transfer programs, and 84 million households. That is a lot of individuals, 326 million individuals in the ECLAC region. 33 monetary transfers cover informal workers. Now let's talk about the amounts of these transfers. We have to point out that these have not been sufficient to cover basic needs. Here you can see in multiples of poverty line, we only see that 6 out of 16 countries grant monetary transfers with an average sum, once again, from March to December, for an average sum that is close to or better than the poverty line. And I'm referring to Brazil, Chile, Costa Rica, 0.9%, Panama, Dominican Republic, but all of the other countries are actually below the poverty line with regard to these monetary transfers, emergency monetary transfers. So this obviously is an issue, and we're talking about extreme poverty, by the way, on the right-hand side. When we talk about the poverty line on the left, no one reaches that level. So that is something that we need to bear in mind, because, okay, fine, we're talking about emergency monetary transfers, but we're not reaching the poverty line. That's what ECLAC suggests, and only 6 actually reach the extreme poverty line. So that clearly is an issue that must be addressed. But let's look at the impact. Now, this is essential. This slide, I believe that the data here, the information here is very, very unique and original with regard to the information that we are providing to you. We can see here how the monetary transfers actually were able to momentarily halt the poverty. We can compare 2019 to 2020 poverty and extreme poverty situation without the transfers. We mentioned this last year. Without transfers, poverty was going to increase significantly. We mentioned that last year from 30.5 to 32. But with the transfers, we were able to alleviate the situation. Not that much, though, because if we look at this in terms of millions of individuals, without transfers, we would have had 230 million, but with the transfers, 209 million poor people. And it's not as if we are making major changes to the poverty sector. We were able to contain it, but it is still an issue. Now, when we refer to extreme poverty, which are some of the figures shown here. In 2019, it was 11.3%. Without transfers, it would have been 15.8. With transfers, we were able to come in with 12.5 as a figure. In absolute terms, 70 million to 98 million without transfers, but with transfers, it was kept at 78 million. So what is the message? 2019, 2009 individuals in poverty, 78 in extreme poverty, 33.7 in poverty, 2.5 in extreme poverty. So basically, the figures were contained. Well, it was slightly halted, but not resolved. So here in the Outlook, we also provide a very detailed analysis of how much it would cost to have a universal transfer, and how much it would cost if we were able to provide a universal transfer all of the individuals living in poverty, because this is where you can have the greatest impact. So we can see here that poverty on the left is 37.2%, and if we were able to provide, let's call it income, true support, real support to individuals under the poverty line, if we were truly able to provide that to all the population groups equivalent to the poverty line, this would bring about a reduction in the percentage of individuals living in poverty, and the Gini would be improved to 0.35. and we were at 0.48, it would be dropped down to 0.35. Now, if we are unable to do that, and of course this would have a price, we have to mention that, 7% of the GDP. And here on the right, we have some disaggregated information. You can see the poverty line information, but this is for all of the poor, all of the poor. If we were to provide this to all of the poor, it would cost 7% of the GDP. 0.7% is what the countries had invested, 1.5, which is emergency spending that we have documented, and additional spending that would be required would be 4.8% for a total of 7%. Now, if we were able to provide relief for all of the poor people, even the extreme poor, if that were the case, we would be able to reduce poverty from 37.2 to 14.7, and the Gini would be 0.39. Now, this cost is much more feasible because it's 0.7, which was what we were having last year. 0.5 is what we have now, and the 1.1 would be the additional for a total of 3.3%. Now, we would like to at least reach that target because that is where we see the extreme poverty. We would like to reach all of the individuals living in extreme poverty. Now, here we have information on how much it would cost to provide relief to boys, girls, seniors. We have broken down this information by age group, but I just wanted to point out these two aspects, which are very much detailed in the outlook. And finally, I would like to include a discussion on one of the aspects that could undermine everything that we have done. I'm referring to vaccination. COVID vaccination is essential, but it calls for a collective effort if this is going to be universal. Latin America and the Caribbean will not be able to secure herd immunity in 2021. The reality of the situation is that we are seeing that internationally there's a great deal of hoarding of the vaccine, and this is having a significant impact on the region, resulting in intra-regional inequalities, inequality between our countries, among countries, and there are other issues, the logistics of the distribution, critical consumables. All of this may bring about a slow arrival and slow vaccination campaign. Here, I would like to point out the fantastic role that primary health care has played. Now, this obviously has been made quite evident in countries that have a good primary health care situation. In Chile, for example, we have seen that there has been quite a degree of success with regard to some of the vaccination campaigns, but still there's a significant degree of inequality with regard to access to vaccination, primarily for developing nations. We have seen that the developed nations have already secured their vaccinations, their vaccines for their population, and we really need to boost the level of international solidarity and national solidarity. We have also not been able for what we need for the national capacity to manufacture vaccines actually be allowed, and that would be key. Now, finally, in closing, I would like to refer to the public policies that we need to ensure that the emergency segues into transformative recovery with equality and sustainability. Now, universal social protection obviously is the backbone of a state that provides well-being. This has been made quite obvious. It's essential to expand coverage for monetary transfers so that we can contribute to reducing the poverty level and inequality. And ECLAC is also referring to the importance of the society of care. Up until now, we've talked about the economy of care, but we would like to now change the discourse and refer to the society of care. I will describe that in just a few moments. And how can we foster equality? I would have to say that this is at the core of many steps and actions. And of course, we would like to see a new social compact that would require a fiscal compact. So let me refer to universal social protection as the backbone of a state that provides for the well-being of its people. Now, we are proposing to maintain emergency transfers throughout 2021 because it is something urgent for the families. Now, at the same time, we need to reinforce the production policies. The companies that have shut their doors need to open their doors. We need to ensure that we have decent work with formal rights. And fourthly, it's important to expand this coverage, and to do so, we need a good financial foundation that is sustainable over time. And we also, without a doubt, need to work toward having a universal coverage for quality healthcare and education. This obviously will call for sustainable, comprehensive social protection systems. And why are we referring to the society of care? Well, we have said that, we have learned as a human race that care is essential. Self-care, we know that we are all, it's a buzzword these days, take care of yourself. By taking care of yourself, you take care of everyone else. And so this concept of society of care is essential, caring for health, education, digital inclusion, basic services, and our planet. Therefore, here I have only referred to health as one of the key aspects. Well, for example, I refer to several aspects, health as a key component, and we need to ensure that primary healthcare is more robust, and also education. Hopefully, we will be able to have our children back in school, and if not, how can we provide support to the teachers and to students remotely, or ensure that there's a safe, healthy, protected back to school experience. And also, let's refer to digital inclusion. We need to make sure that digital technology and access to internet is something that is universal. And we also need to focus on the capacity building with regard to the skills of students and education sector workers, and of course basic services in rural regions, sanitation services, water service coverage, and invest in appropriate dignified housing and improve marginal neighborhoods. Now, all of this is essential, and we have measured to a certain extent how much unpaid work of the households actually factors into the GDP. And we have more detailed information in the report. I would like to point out two countries. Mexico has a satellite account, and Mexico has been able to successfully have 23.5% of the GDP express the weight of the unpaid work in Mexico. In Costa Rica, 25.3%. These are the most updated figures. All of the countries should measure this category so that once and all, we would be able to fully understand the virtuous cycle of the care economy and invest in this sector and boost employment and view this sector as a dynamic sector that in turn brings about new resources. This is essential because this would allow us to have an even playing field with regard to employment. We know that women are obviously encouraged to work, but often they're discouraged at the same time because they need to care for individuals at home. And if they were addressed there, this would be key. This would allow us to close the income gap and the inequality. We need a new social compact for equality and sustainability during the times of the pandemic. The pandemic hit us at a critical point of time. And also this social unrest that was bubbling up throughout the entire region to a certain extent. Now, this has required us to forget about and leave behind a culture of privilege, and in this process of reaching agreements that are focused on well-being and rights, we need to ensure that all of this be a factor in transformation and change in rights. We need policies that are based on widespread discussion, but with a clear horizon. Structural change, we know that the horizon is a new model for development. We don't want to have any setbacks. We want to redistribute resources and opportunities. We want to ensure that our identities and rights are recognized. It's not any normal standard agreement. We want awareness that And we also see that there is a rising challenge related to sustainability of social protection, which is key, but of the entire planet. We've already said this, and the new social compacts and agreements will call for fiscal agreements that will foster progressive, sustainable solutions for well-being, and let's do away with tax evasion, and let's make sure we have a more progressive system.
And lastly, to conclude, I would say to promote equality, we cannot ignore how important inequality is and how it affects all of our efforts. First of all, we believe, of course, that the government's efforts of emergency transfers must be maintained, and this will therefore underscore the role of public policy and the role of the state. Second, we need to avoid the false economic health dilemma. We need, of course, to have sustainable, resilient forms of productive employment with rights, as well as in the region. Of course, we have the 2030 Agenda for Sustainable Development with equality at the center, which also reinforces the need for universal, comprehensive, sustainable social protection systems. Therefore, to overcome this crisis, we learn the lesson, and that is that the only way to build a better society is a welfare state and a care-based society. Thank you very much, and I apologize for taking so long, but it is a very substantive report, and it is certainly, I believe, the first one of its sort to address the issues that have occurred in the pandemic, and look forward to what is coming in the future. Thank you very much.
Muchísimas gracias.
Thank you very much to the Executive Secretary. This concludes the presentation on the 2020 Latin American Social Outlook. Here at ECLAC, we will now open up to the press conference, and we thank the journalists from the region and from across the globe for their questions. Let me now address the first set of questions. The first one, Executive Secretary, comes from Marcia de Chiara, a journalist from o Estado do São Paulo. And the question is as follows: what increment was there in the number of people who are hungry in Brazil, in Latin America, last year as a result of rising food prices? The second question is, will we continue to see hunger in Latin America and Brazil? If so, why? The second question, or second person posing a question, is well known to us here, Daniel Colin from NTN 23 of Guatemala. Then his question about the data is, what is the forecast for Guatemala, and whether it would help that frontline workers are now being vaccinated in Guatemala? And the third set of questions for the Executive Secretary, we have Andrea Restrepo's question from Noticias Caracol in Bogota, Colombia, who would ask you to address the situation specifically in Colombia in greater detail. With these three questions, we will begin the first segment, again from Guatemala, Brazil, and Colombia. Thank you very much for your interest and for sticking with us. Let me respond to Marcia de Chiara's question first, and let me speak to the question of Brazil, the number of people who go hungry in Brazil and in Latin America, or have done so last year as a result of the pandemic. and she referred to something that's of the utmost importance, and that is rising food prices and what will happen in that regard in Brazil and Latin America. What I can say is that we do not have yet the figures published on a regular basis by the FAO. However, based on our calculations of extreme poverty, because we do measure extreme poverty on the basis of the impact or the availability that households have to access a basic set of foodstuffs, and this is a good proxy for food insecurity measurements. What we are seeing in the outlook is that the direct impact in Brazil is an increment of 1.2 percentage point between 11 and 12%. Excuse me, that's Latin America, the region overall, not just Brazil. But the outlook indicates a rise in 1.2% in extreme poverty. That is to say, approximately 8 million more people in extreme poverty in 2020 as compared to 2019. And of course, these are the individuals who are not able to access those basic foodstuffs. If we look at the measures that countries have taken, we can see that if the countries hadn't taken measures, both cash and in kind, the increment would have been 4.5%. So we're looking at an impact of 1.2% that occurred versus 4.5% that would have occurred had these transfers not occurred. If we look specifically at Brazil, if we look at the ongoing transfers, the program known as Bolsa Familia, again, without those measures, we would have seen an increment in 2.5% in extreme poverty. However, that was 1.4%. In other words, these transfer programs were very effective in Brazil. The challenge is maintaining these measures. How do we ensure coverage and sustainability of these measures so that in the future, this rate can continue to be contained? Now, as to the question of rising food prices, inflation was just over 13% in 2020. That is 10% more than 2019. This has a tremendous negative impact, particularly in the poorest homes, because the access to food obviously is also affected with rising prices. So what is going to happen with hunger in Brazil and Latin America? Obviously, the FAO will not let me lie. It is going to be very hard to hit goal number 2 of the SDGs by 2030. Eliminating hunger will be extremely difficult to attain. The crisis that we had in the 1980s, it took us 25 years to get back to pre-crisis levels, and the current economic impact that a region has suffered, it does create a lost decade. It's worth and 10 years worth of economic backsliding and 15 years of backsliding in terms of poverty. Therefore, it is tremendously important to maintain these programs in coming years, but to continue to move into comprehensive universal systems that contribute to better recovery. Let me turn to the question from Guatemala on the outlook there and whether the vaccination efforts of medical personnel there will help. Obviously, the healthcare crisis in Guatemala as a result of COVID-19 has been magnified, as we've said here, as a result of the vulnerability that Guatemala has had vis-a-vis climate change. As we know, Eta and Iota, the hurricanes, had a devastating effect on the population there as well. We do not have a recent survey on living conditions in Guatemala, but we do have our forecast for poverty levels, looking at such factors as variations in GDP, the labor market, and assistance programs that have been implemented in the last year. In that context, therefore, our calculations is that extreme poverty would be around 19%. That's 4% higher than what we had in 2014, which is the latest information we have. So 19% in extreme poverty. Total poverty is higher, and that affects 1 out of every 2 people with a less pronounced increment, but nonetheless a significant rise. We believe that for 2020, the poverty rate could be significantly higher. Again, looking at 2014, again, those rates are higher today than they were then. Now, according to the UN Food Program, and I'd like to note how important the program there has been, we can see that the number of people that are hungry in the primary countries of the isthmus has risen to 2.2 million people, and then in 2020 to 2021 is now up to 8 million. In other words, almost a fourfold increment. And the impact of the hurricanes have been tremendous. Eta and Iota have fundamentally impacted the social sector and the productive sector, particularly food and livestock production. And we can see that in agricultural, especially, the 92% of the damages occurred in the case of Eta and Iota. And as you know, we have been looking at the impact of these hurricanes, and we've seen that the total amount of losses and harm and damages was 6 million quetzales, 6 billion quetzales in the case, again, of these 2 hurricanes.
The Guatemalan economy has also facing a contraction, a recession, and this has 6.1% contraction, and we have estimated for 2021 that there will be a 3.7% recovery, but we already know that this recovery will not compensate for the situation, and they will not reach the same level of economic activity that they had back in 2019. Now, there has been an incoming positive inflow of remittances, and that clearly has aided the poorest households in Guatemala. Now, perhaps vaccination can help. Of course it can. There's no doubt about that. And what is key here is to make sure that the vaccination process is steady and constant and the entire population is reached. I think it's important to foster the efforts carried out by COVAX. Latin America may actually have 26 million doses, and possibly in Latin America, Central America, 2.2 million doses, and hopefully Guatemala will receive 631,000 vaccinations through COVAX. Now, Andrea Restrepo from Caracol asks about the situation in Colombia. Well, poverty has grown. It was already increasing in Colombia prior to the pandemic. 1.8% percentage point from 2018 to 2019 was the increase. And so the incidence 29 to 31.7%. So clearly there has been a deterioration in the individuals living in an indigenous situation also increased. And the reality is that there have been increases in these areas. Inequality, according to Gini, also increased in Colombia. It was 50.8%. Rather, in 2017. In 2019, it was in 52.6. So clearly there is a deteriorating situation with regard to that. And poverty, as far as the estimates from ECLAC are concerned, 3, and poverty from 29 to 34.1%. Now, these are our estimates. As I mentioned early on, these are estimates for Colombia, or the first ones were from Colombia, 10.9 to an increase in poverty, and our figures, well, Colombia figures show that total poverty will go from 29 to 34.1%. The labor market obviously is quite fragile with regard to its structure in Colombia. The national unemployment rate increased 5.4 percentage points over the mobile quarter from August to October, and it was at 15.4%, with an upward trend in 3 of the main cities. And clearly, this, once again, has impacted women more. And in countries such as Colombia and others, we have seen that the structural situation regarding the informal market has worsened, and Colombia has an employment mission that has been taken on by the government, which is essential. Now, the government policies have also been crucial. They have allocated resources equal to 1.3% of the GDP. They have boosted the number of transfers to the vulnerable population. They have also funded what they call the solidarity income, and this has allowed for distributing resources equal to 0.45% of the GDP. And in 2021, it is expected to see that there will be spending equal to 0.29% of the GDP. I think it's important to talk about how the labor market has been greatly impacted, and the government has earmarked resources equal to 1.7% of the GDP, 1.6.7% of the GDP to protect employment. This is essential, and this 40%, in fact, of the minimum wage has been recognized for all employees in companies that have seen a 20% drop in their revenue, so this has been, Colombia has provided support for households, for companies, and this is essential for rebooting, if you will, the labor market. With regard to women, women have received a subsidy that went from 60% more than the minimum wage. So I think that is essential, and there has been a great deal of progress with regard to what the government has tried to do. I think one of the major challenges that Colombia faces today is the Venezuelan migration crisis. This continues to be an issue, and Colombia is making progress with regard to vaccination. I believe that's another key issue. They just wrapped up the negotiations for 67,000 doses for a large percentage of the population, and this perhaps will pave the way for a better recovery period. I wanted to underscore that there are very important programs out there to provide support to women. Emprende program is a program that has been launched by the government to foster leadership of Colombian women. Marta Lucia, the VP, has played an active role in this realm, and DANE, the Statistics Institute, has also significantly supported the rest of the region, and this DANE Institute actually is the lead agency leading up the statistics conference. Thank you very much for that. We have received more questions as part of the second block of questions. And with regard to this new set of questions, I would like to refer to Fabián Andrés Cambero from Reuters. The question is, do you think that the region can actually take off economically once we have overcome the pandemic? And there are internal issues and social unrest. Do you think that these will cause an additional delay in recovery? Specifically, there's concern for with regard to the increased price of staples. Will that aid to the recovery? And anyhow, these are the questions from our colleague Fabián from Reuters. Michael Stott from the Financial Times for Latin America has the following question. I'm going to read this in both languages.
Responses had been limited to fighting the virus, with little thought given to serious long-term reforms. Do you see any evidence that governments in the region will introduce policies to improve equality and social justice? If so, which countries? Hasta el momento parece que los gobiernos latinoamericanos
Now I'm just going to read it in English, in Spanish rather.
Reflexión a reformas de largo plazo más serias. ¿Piensa usted que o observa alguna evidencia de que los gobiernos en la región vayan a introducir políticas para mejorar igualdad y justicia social? Si observa alguna esta evidencia, ¿en qué países? La consulta de Michael Stott.
So this is a question from Michael Stott from the Financial Times Latin America. And now, for the second set of questions, I would like to refer to a question by Silvia Rodriguez from Milenio Journal in Mexico. Silvia asks the following. What do you think about how the Mexican authorities have faced the COVID-19 crisis? Have the decisions worsened inequality and poverty? And I would like to know your opinion on the reform of the electric industry law. How will this impact the economy? Now, questions, these three questions. Let's start with Reuters, followed by Financial Times, and then Silvia Rodriguez from Millennial Journal in Mexico. These are the questions. I will give the floor back to the Executive Secretary. Thank you so much for that, Fabian. Andres Cambero from Reuters in Chile. Do you think the region will be able to economically take off once we have overcome the pandemic? Or what about the internal and social unrest issues? Will those have an impact or delay the recovery? What about the increase in raw materials or staples? Will this, what about structural solutions? Now, with regard to the preliminary balance of the economies from 2020, we talked about how in 2020, we had a 7.7% contraction of the GDP. For 2021, we are seeing a certain amount of bounce back of 3.7%, bouncing back. But we will not be able to reach the same economic levels that we had in 2019. We won't be able to do this in 2021, nor will we be able to do so in 2022. Let's say the growth rates were 1.8. Well, perhaps that would allow for recovery in 2023. Now, if that's not the situation, obviously it will take us much longer to bounce back. If we will grow at the recent rates, which is 0.3% growth rate. So clearly there will be a bounce back this year, economic recovery this year. But what we're also concerned with, well, the region has not fully recovered from the pandemic. I think this is essential to point out. We have not recovered from this emergency as of yet. Obviously, many countries are trying to do the best they can with regard to opening up their economies, but we are still going through the pandemic per se. And the problem is that the vaccination process in the region is plagued by inequalities. Now, we actually are assessing access to vaccines in each country, the current situation, what vaccines are being rolled out, and the major challenges that the countries are facing in this regard. Now, obviously, there's no doubt about it that herd community is what we are aspiring to in the region, so that we could actually begin true, real economic recovery. Now, in the meantime, the emergency measures to provide support for the poorest households and measures to pro-business measures to boost the business sector and employment, all of this is key. Internet connection, all of this is essential, and this will be a significant support. But obviously, as mentioned by Fabian, the social compacts are key because societies are demanding more equality, more universal social protection, better quality public sector services. And this is the key. How can we tackle these concepts and aspects. When we addressed these, we realized it was quite clear that it was essential to invest in health, nutrition, in order to overcome some of these structural divides that our societies are facing. And of course, it's essential to create employment. We view this as one of the most important challenges on the floor and for the future. Now, hopefully, we will have a decent, rights-based, formal jobs created. Now, if we increase the price of copper, obviously that will be a key for our country, and that will help the exporters, but not the importers. The oil importers will not receive any relief in that regard. So if there's an increase in the prices of raw materials, the impact will be different, varied. Now, it's important for the region to learn the lessons of the past, and that we were unable to bring about structural changes to the production sector, even during a period in which there was a raw material boom. I think now it's essential to bring about structural change with regard to our industrial and production sector, so that we can have a better situation for exporters, for copper, oil exporters, and how can we reinvest the proceeds in order to have a more robust industrial production structure. We do not want to depend so much on the outside world, and we want to boost our national and regional value chains. I think we truly need to target regional and national growth in that regard.
American editor, Financial Times in English as well. Thank you very much for your participation and your questions. I think this is extremely important to have you with us. And of course, so far, Latin American governments, you say, the responses have been limited to fight against the virus. And of course, with little thought to long-term reforms, which is our major point that we would like to make in this presentation, of course, and how, what is the evidence that governments in the region will introduce policies to improve equality and social justice, and in case this is the case, let's say, in which countries. So let me quickly address your questions. In order to face the pandemics, I think governments have focused basically on the emergency responses. I have to stress that this response has been quite important, especially in terms of population coverage. As I said before, the emergency social protection measures are covering 49.4% of population, of regional population. This is very important. It's a great effort that is stemming from our region. And we're talking about emergency social protection measures such as cash transfers. In this panorama, we are mentioning basically social measures. Now, we are talking about $86 billion, which is a lot of money for countries of this region. Now, these policies have mitigated increases in poverty and extreme poverty. Right now, what we are aiming at is to ensure that these emergency protection measures can be sustained, can be and could be sustained, expanded, and hopefully increased in order to guarantee the basic needs of the population. And this is with I would say, with the objective of sustaining consumption levels, and therefore to prepare, let's say, for a more structural recovery. Now, obviously, and this is something that ECLAC has been stressing over and over, and that is that this region needs structural changes, and we need to ensure comprehensive social protection systems. And this is the problem. These pandemics magnify the structural problems of the region, and in which we have fragmented and unequal health systems and social protection systems. Now, we have to ensure the sustainability of this and the sufficiency of financial resources. And of course, this region is already confronting fiscal deficits and high debt. So international cooperation here is going to be essential, because, and this is again one of the main objectives that ECLAC is posing at the international community, this is a region basically conformed by middle-income countries, and these middle-income countries do not have access to concessional resources. And I think this is time to mobilize financial resources to this region and to make sure that this region is capable of sustaining the social emergency measures, but also to move towards a social protection system that is more universal. I think that another of your questions was basically whether I see any evidence that the region will introduce policies to improve equality. I mean, if we can put the example of Chile, I think this is a very clear example that before the pandemics, actually, the society was in the streets asking and requesting and demanding equality, right? So it's not only whether the governments would like to push for more equality, is that this is a social claim, this is a social demand stemming from all the region. This region is the most unequal region of the world, not the poorest, but the most unequal region. So that's why I guess that we have to stress that starting with the emergency income, that has to be at least covering all the people in the situation of poverty, but little by little should become more amplified and more expanded. That this region needs to move into more equal societies, no question about it. And equality is a driver of growth. That's what we need everybody to understand. Equality is not a result of growth, it's a driver of growth. Is a prerequisite to really grow better. Now, ECLAC, I think, has encouraged governments to prioritize health workers in their vaccination strategies, and I think this is something that is working in a way that almost all the countries are really moving into that direction. And I have to say that of the health workers, the majority are women. I mean, of the total workers in the health sector, 73% are women. So moving towards the vaccination and strategies for these workers is going to protect also women as much as possible. Of course, we see countries moving in the direction of gender equality, for example. That is something that we see clearly, that there is I would say, in certain sense, we believe that countries like Chile, like Colombia, like Mexico, are really very committed in terms of gender equality. Costa Rica, of course, and we see that that these countries can I would say can understand very clearly that women's participation in the economy, not only in the care economy, but in the economy, can be a very key part of the recovery. So that's very important. Now, there are countries that are better off than others, of course. I mean, we can see the case of Uruguay and Costa Rica that have had less mortality rates and less contagion than others. So when you ask me the question about how which countries are going to recover faster than others, I mean, it's a very tricky question in a way, because it's not easy, but we do believe that countries that have almost all the countries have understood that equality is a driver of growth, almost all of them. Now, which of them is going to be more effective in implementing these policies? That's the question that we have to look at. I mean, there are countries that are making an emphasis in trying to close the gaps. For example, the digital gap. We have just finished a coalition. We are supporting 3 countries of this region for a universal digital inclusion of women, which is Costa Rica, Uruguay, and Chile. And that's going to be very helpful. I mean, these are new tools for equality. Digital is one of them. The digital inclusion, it can be one part of the equality, but income is another very important source of equality, and of course, jobs and decent jobs. And that's what I think we have to look into. Now, I think I answered most of your questions. Of course, I stand ready for any follow-up that you would like to do with us and my team to respond to your more particular questions. Me voy entonces a la pregunta de...
Let me turn to the question by the journalist from Mexico about how Mexican officials have addressed the COVID crisis, the decisions, and how this ties into poverty and our opinion on the electrical energy law. The policies in Mexico vis-a-vis the pandemic have been notable because perhaps one of the goals of this administration has been to combat poverty and inequality. Mexico, we could say, started before the pandemic. They started focusing on the poor pre-pandemic. I think we need to be very clear on this because it depends on when we analyze things. In Mexico, the monetary transfers were moved forward, they expanded them as of 2019. So this is something that I would very much like to highlight. Second, I think that there has been a very aggressive policy to convert hospital beds, although there were times that were truly critical. I believe this aggressive approach to convert hospital space and beds was helpful. An additional 50,000 people were hired in the healthcare system. And I believe that what has been particularly helpful in Mexico has been the active approach to acquiring vaccines. And they have already performed 2.5 million jabs in a country of over 110 million as compared to Chile, which has 17, 18 million. So we need to compare. Obviously, it is a much bigger challenge in terms of what is happening in Mexico and vis-a-vis the rest of the region, except of course for Brazil. The other thing that I wanted to highlight in terms of Mexico is that Mexico, as the chair of ECLAC, has worked hard to mobilize the international community, even at the level of the Security Council, for more equitable distribution of vaccines in distributing country, and that there be less hoarding by the richer countries. I don't know if that will succeed, but it has been a very appropriate approach. And the UN in New York did pass a resolution on universal access to medication and medical equipment. Mexico also has an open data policy and platform, and the updated daily information reports has been a significant contribution to transparency. The progress has been important, of course, but the Secretary of Health has provided guidance for patients. They have the system of the traffic light. There has been less lockdown in place in Mexico than other places in the region. Perhaps there's been more contagion as a result. But in any case, there has been information that has been very open, and I think the data is certainly available. Of course, there's a lot of controversy as to whether things are being done well or not, but that is certainly happening in virtually every country. What does seem to be important is that Mexico has made an effort to raise minimum wage, something they had not done in recent decades. It was the country that was lagging the farthest behind in terms of minimum wage, and so that is a significant step for the country. Certainly, the effort at building a welfare state is certainly present, and that is a topic of note. Another important area for ECLAC is tax collection of major taxpayers and greater equality, with reducing gaps in the payment of taxes, and tax exemptions were a strong measure. Of course, there's still a lot to be done. It is a country that has tremendous inequalities and a lot of asymmetries, even between and among its own regions. It is an ongoing effort, of course, that needs to be done. I just want to highlight that when Mexico expanded their transfers, they did so to the extent of 0.85% of GDP, particularly for senior citizens in some areas. And of course, the direct transfers expenditures in Mexico is now around 1.3% of GDP. We all say that the region is investing 1.5% of GDP in emergency measures, but in Mexico, they began doing this in 2019, and the investment there is currently 1.3% of GDP. And that is significant. As I was saying, I think that the topic of minimum wage, of course, has also been a significant step. As to the power law, the electrical energy law, let me just note that this is something that is being discussed. One of the objectives of the proposed legislation is the so-called rescue of the power sector, looking at the two major power companies. And the belief is that both engage in strategic activities and that are of the utmost importance to growth and to other industry. I think what they're trying to do in a very tough time is to review whether there have been inappropriate hiring or public procurement processes and in the construction of the gas pipelines. I think that's one of the objectives here, is to look at the contracts specifically. From our perspective, it is important to note that there is growth there, and the power sector is certainly something that is so close to the companies. There's something that's very important to general people as well. From our perspective at ECLAC, we believe this should go hand in hand with a broader approach to energy. We believe that renewables, non-renewables, which are non-traditional renewables, can be tremendously helpful in the mix in Mexico. And this is a topic, of course, that should be looked at in greater detail and should be added to the topic under discussion. Because at ECLAC, we have evaluated the greatest proportion of direct foreign investment that has come into the region in the previous year was specifically, as we saw, in renewable energy. So therefore, there is an appetite among international companies for renewables. What we do need to do, however, is to provide certainty to these companies to see whether these criteria are going to be reviewed or revamped, and whether the contracts are going to be reviewed or revamped, and that's certainly valid. But once that process is over, then clear, stable rules should be established to ensure that investment continues to flow. Mexico continues to be very attractive for direct investment, and the power industry is no exception. This has to do, of course, with the proximity to the United States. These are two topics of tremendous importance.
As demostró. And the recent crisis in Texas also showed how important it is for Mexico to move quickly toward energy independence. I think that situation made this quite clear, and that's what the government is seeking: greater autonomy and greater national capacity to meet its own demand and then clearly address the external market. Now, if the price of oil increases, that will clearly favor Mexico. Thank you so much for that, Executive Secretary. And let's move on to the next block of questions. We have received a question from Josefina Bruni from Latin Finance, Ángel Aguilar from La Razón in Mexico, and Marina Costa from Hoy from Santo Domingo. And I would like to also mention that this suite of questions refers to IPS, El Diario from Spain, and a journal from Peru. This is the third set of questions. Josefina Bruni from Latin Finance says the following: 26th of September in 2020, the president of Costa Rica, Carlos Alvarado, submitted to the UN General Assembly the request to create a fund to support the economy for COVID-19 issues, and this could help the social situation. How has this initiative been accepted by the developed nations so far, and how much progress has been made with regard to this on the international agenda, and what future do you see with regard to this for the upcoming year? That was from Josefina Bruni from Latin Finance. Thank you, Josefina. Ángeles Aguilar refers to some of the concerns that Silvia Rodriguez already mentioned, but if you would like to expound upon that, that's fine. Ángeles Aguilar from La Razón in Mexico says, how has poverty and vulnerability in Mexico been affected? It's one of the most affected countries in terms of the death rate. What are the challenges they're in, and what type of support can be carried out in terms of strategy? Have the strategies adopted been sufficient? How does Mexico compare to the other countries in the region? Marilena Costa from El Diario Hoy in Santo Domingo, Dominican Republic. I would like to know what the figures are in Dominican Republic with regard to poverty and employment for 2020 and potential estimates for 2021, and what measures do you think the state should adopt to provide support? Those are the questions in the third set of questions within the framework of this press conference. I would just like to mention Josefina Bruni from Latin Finance, Ángeles Aguilar from La Razón in Mexico, and Ms. Costa from Hoy Journal in the Dominican Republic are the three journalists asking questions in this third suite of questions. Thank you for that. All right, Josefina Bruni from Latin Finance. Well, she mentioned that Carlos Alvarado submitted an initiative called FACE to address the various needs related to the health emergency and recovery. How much progress has been made? How do we view this? Now, this was actually submitted by Costa Rica to the rest of the countries in the world at a summit that was summoned by the Prime Minister of Canada and Jamaica as well. And this is a summit that seeks funding for development during the pandemic and in post-pandemic times. This process actually was launched back on September 25th during a dialogue by the heads of state, international financial agencies, and us as ECLAC are also providing support for this process, significant support, in fact. And so the proposal consists of setting up a fund of $500 billion fund, roughly, to provide support to the various countries, regardless of their income level. The idea is that the fund would not be limited to lower income countries, but rather the purpose is for it to be for all of the countries to be eligible regardless of their income level. And obviously the idea is to provide support for the middle income countries. But in any event, this initiative is for $500 billion, and it is feasible, right? $500 billion is equal to 0.1% of the GDP of the developed countries. And it's a long-term fund repayment in 50 years. We've already seen some bonds that have been placed in Peru for a 50-year term, and interest is close to 0%, 5-year grace period. So this fund aims, the proposal is that this be managed, administered by international or multilateral banks, IDB, the World Bank, CAF, etc. Those are possibilities. But the idea is for the funds to be made available to the countries. They're not grants, actually. They're not grants. The purpose is to have a fund with loans with practically zero interest rate and a long repayment term. I would have to say that this has been broadly well accepted. For example, Spain, the leaders of Spain referred to their acceptance with a great deal of interest. And I think right now what they're negotiating internationally is for countries such as the one, our countries, that they are seeing an increased debt. And so it's essential to have financial resources from the international community and have liquidity above all. So several initiatives are in the pipeline. For example, special withdrawal rights. This is an initiative spearheaded by the US, apparently, as a result of the letter sent by Janet Yellen to the G20, requesting a more flexible, showing that there's a more flexible position by the US with regard to 500 billion special withdrawal rights. This would help the country's liquidity, primarily at the central bank level. Now, this initiative, FACE initiative, is also related to liquidity that could help the countries to have the necessary resources to deal with this emergency and to begin the early stages of hopefully a transformative, sustainable recovery. So there's a great deal of interest with regard to this initiative, and obviously there are other ones on the table, for example, bonds related to the SDGs and the 2030 agenda, for example. Also, a great deal of interest is being placed on alleviating the foreign debt of the Caribbean nations that are very much affected by the pandemic and climate change. So this is interesting because the purpose is to provide support for countries' liquidity regardless of their GDP, per capita GDP, because that is always something that separates the countries into different groups. The G20 adopted an initiative to halt debt, but middle-income countries do not qualify. So this Costa Rican initiative is essential, and I believe that this will continue to be a key issue. And for example, with regard to funding for development, we have underscored this Costa Rican initiative. And on March 11th, there will be a presentation regarding what the region thinks about funding for development. Now, Mexico, journalist Aguilar had a few questions with regard to Mexico. What are the major challenges? What are the measures to boost the economy? And how does Mexico compare to the rest of the region? Now, we just recently took part in a seminar organized by the National Institute for Public Health. And in fact, we talked about the key challenges that Mexico is facing now. That seminar referred to how progress can be made toward effective universal service of a public health system and how to make the primary healthcare systems more robust. We know they play a key role in Mexico, and that actually, I would have to say, could be the key piece in the puzzle of effective vaccination with universal coverage. So primary health care, I think, is one of the most important issues in the region, and well, not most important issue, but a key issue. And then funding for health, obviously, there's increased need for funding for health. Mexico, for example, has roughly 3% funding for health. I think we also need to address undernutrition and malnutrition. This is a pre-existing condition in many households in Mexico, and I think if they were to focus on food labeling initiatives, that may be helpful. This is one of the concerns on the agenda in Mexico. How can we provide support for the economy? Well, there are several different measures. For example, working with the pandemic, and the health sector plays a key role there. Increasing minimum wage, that's essential. It has been expected that there will be a 15% increase for 2021, and the current administration has already boosted the minimum wage by 50%, primarily in the northern region, where there has been a greater increase specifically to boost those wages in the northern region. I think the effective date of the free trade agreement with Canada and the United States, I think that provides many fabulous opportunities for Mexico to also attract companies that are looking for nearshoring, that want to gain a foothold in the North American markets. Mexico is also referring to large-scale investments and infrastructure projects, and that I think would also be a possible track toward recovery. With regard to poverty, now, with regard to the pandemic context, income per inhabitant in Mexico dropped by 10% in 2020. So poverty has risen to 50.6%, 9 percentage points more than 2018. Extreme poverty has also increased to 18.3%, 8 percentage points more than in 2018. Now, logically, these are our forecasts, and these do not necessarily coincide with the Mexican ones. In some areas they do, but our forecasts are based on the labor market, labor market income, and the various measures taken to alleviate the crisis. Now, I also think that the infection levels in Mexico have increased, primarily because there's overcrowding in Mexico in some areas, and this has made it difficult to implement measures to contain the virus and contagion and infection, and as a result, there have been higher infection rates. Also, there are many towns and areas that do not have access to proper water and sanitation services. So today, I think it's critical to figure out how Mexico can best prepare for a widespread, more effective vaccination process. Marcelo Ebrard and the Secretary of Foreign Affairs have done a fabulous job in securing the vaccination in Mexico. That was a significant hurdle they had to overcome. And how does Mexico compare to the rest of the countries? This is a very challenging, complex issue to refer to, because obviously each country has its own national unique context. So who can we compare Mexico to? If we compare it to Brazil, Mexico's doing better. We see that the infection rates are dropping in Mexico and increasing in Brazil. So it's challenging to compare. And each country is unique. Now, I do think it's key to point out how Mexico has really done its best to work better in the international field. For example, they've worked with Argentina, they've worked on manufacturing vaccines, and clearly the World Trade Organization does not agree with allowing the patents for the vaccines to be freely used. For example, Mexico, Brazil, Argentina, and other Chile, Colombia, other countries that have the manufacturing capacity could support the vaccine manufacturing effort. And I think that's a key issue. And I think Mexico's played a leadership role in that area to try to close this gap. Mayalina Costa from Santo Domingo, from the Dominican Republic. Boy, poverty figures in that country. Well, let's talk about that.
Was to 21.1% in 2020. This increment is less than what would have happened if there had not been any protection measures in place which did of course occur. There was a transfer program, there was a stay home program. And so if poverty was at 21.8%, without it, it would have risen to 25.5%. I think the impact in the Dominican Republic has been the reduction in the employed population by 8.8%. Women were hard hit by with 10.1%, particularly in tourism, which for the Dominican Republic is such an important sector. And therefore it is important to highlight it. Inequality also rose in 2020, unfortunately, from 0.43 to 0.48. And that is a topic of concern as well. The support that can be given to companies is one of the major issues that need to be highlighted. The Dominican Republic launched a reactivation plan for SMEs and contributed important resources to the corporate world to help offset their operating costs and the tremendous impact of the pandemic on these companies. Reactivation plan provides working capital and supports cooperatives and other forms of associative work. Supporting SMEs and mini SMEs is important because they are the largest employers in the country. In addition, there's support being provided to the agricultural sector, which is key in generating safe markets. The DR has launched interesting projects such as insurance for tourists, providing health insurance for visiting tourists, which is creative, as well as supporting SMEs in the tourism industry. So those are some of the points that I can make with regard to the Dominican Republic specifically. Thank you very much. We are now moving toward the close of this press conference. Let me note 3 questions, however, that we have received from IPF of Italy, who wonders, women and migrants are doubly hit by the pandemic. What are the figures in the region? What is being done to overcoming their challenges? And if there are any features, what features should the protection systems have? And can this include transfers and programs aimed at reactivating the economy? Ignacio Farisa from El País of Spain asks whether you could highlight any success stories in terms of social transfers that have been implemented since the beginning of the pandemic, and also if there are any that did not work as expected. From Peru, the question is, how much has poverty grown in Peru in 2020? What is the forecast for 2021? And is addressing the question of what can be done. You've already addressed that, I believe, and what is the forecast again? So we have our 3 questions. Madam Executive Secretary, you have the floor. Thank you very much. I will try to answer these 3 questions from IPS of Italy. Migrants, women, of course, are doubly victimized. Yes, we are calling for universal systems, as noted, ensuring social protection for all, and with a view toward reactivation. According to UN calculations published in July 2019, Latin America and the Caribbean has a migrant population of just under 42 million people, some 15% of the 272 million worldwide. This is a figure that does not reflect the most recent migration flows because it is through 2019. So this does not include, again, more recent movements. And it also doesn't include returns, but that is the figure we have available to us. In the case of Colombia, we do have some interesting statistics because at the end of 2020, there are 1.7 million Venezuelans who are residing in Colombia as immigrants. That is also, as we can see, 56% of migrants are in an irregular status. So perhaps with the new regulations on the temporary status of migrants, we may get better information and draw these individuals into the regular legal system. That is what I can say in terms of the statistics. Now, as a result of the pandemic, adversity is exacerbated for migrants, undoubtedly, and the loss of employment, the drop in paid domestic work is a huge topic in this regard. Many of these migrant women are working on the front lines of domestic work, and therefore this is an issue, along with expedient access to documentation, access to medical care because they're not registered with the system, and the stigmatization, of course, are issues that migrants face in our region, and those I would expect from our region moving into the US, which is a huge topic as well. These are subjects that have to be addressed. I think the topic of working women migrants is a topic that ECLAC is looking at quite closely, because migrant workers, and particularly female workers and women across the region, but particularly migrant female workers, have been exposed to tremendous levels of risk because they are working in high-risk areas and industries. And it's also associated with informal, unprotected work in many cases. And so this is a topic of the utmost importance. We believe that paid domestic workers or migrants represent 17.2% of all domestic paid workers worldwide. So this is a worldwide figure again, but it gives us an idea of what the dynamic in migration is and how it is affected by gender inequality. Of course, it is, as you've noted, urgent to grapple with these challenges. Of course, we are working hand in hand within the UN, the humanitarian pillar, including UNICEF and so forth, is working in support of migrants at the border and along their path. This is, of course, tremendously important. In the case of Mexico and the United States, Central America, Northern Central America, and Mexico specifically, I think that there is hopeful news in that the Biden administration has announced that he is willing to invest some $4 million to address the root causes of that migration. We at ECLAC have coordinated a very interesting exercise with 21 agencies in the UN and 4 agencies or national entities from El Salvador, Guatemala, Honduras, and Mexico to look at what the root causes are of the migration, where and how and what actions might be taken that would have the greatest efficacy so that migration becomes an option and not an obligation. I will hope that we can, as a result of these announcements by the US, roll out this comprehensive development plan, working again hand in hand with other institutions such as the Inter-American Development Bank, which has offered its support as well. This is a very detailed plan with over 114 projects that have already been funded and can begin immediately. That's one of the advantages. As to whether ECLAC includes universal systems, well, what does that mean? It is a system of social protection covering the entire population, independent of the type of participation in the labor force or other personal features. ECLAC calls for a social protection system that provides access to healthcare to all individuals. That should not be dependent on income. Health should be a universal public good. Of course, there will be people who pay more, those who do not pay, but the principles have to be of quality care. And that is one of the major issues in universal social protection. Second, the sustainability of appropriate coverage and social protections in the pension and other social protection systems, which of course is key and should be included in this universal status. Also, measures for formal workers and hopefully including them in contributory processes that should be co-financed by workers, employers, and the state to ensure that, as we've seen in great detail here at ECLAC, it's not just a question of pay as you go or contributory systems, but sort of more mixed systems, of which there are many across the region. We also need a pillar of solidarity to be made available in this pension program, because there are a lot of people who have not been able to contribute, women particularly who have gaps, and therefore non-contributory Social Security is extremely important. And so therefore, I believe in the area of social protection, we need to include the dimension of social protections. Very few countries have that. And of course, the area of gender. There is the topic of care, of course, which is extremely important. So this cannot all fall to women in an unpaid, uncompensated fashion. So we need infrastructure, we need employment, we need training for this economy of care. How do we make the transfer programs compatible? How do we reactivate economies? I believe that all of these measures should serve as the foundation for recovery. Public policy today is focusing on overcoming the pandemic, of protecting income, of protecting productive capabilities. All of this can help to reactivate employment in households. And for this to transpire, we refer to some sectors that may provide a greater catalyst than others. Society at large, I believe, is willing to expand their contributions as long as there is equality and balance in the measures taken. Connecting recovery to the pandemic requires short-term measures, sustained measures, at least throughout 2021, to continue to support small and mid-sized companies and mini companies, but it also means making substantive progress in digital inclusion, in innovation, in training workers, and in building new abilities and identifying new sectors that can help, again, be catalysts for employment, but also be more sustainable environmentally, and that can also deal with the external gap. Some of these sectors that we have identified is the transition in energy to more renewable sources, electromobility, solutions based on nature, circular economy. We've sought to look at certain sectors that are in a position to perform. Right now, recycling is another major topic where our continent and countries can do this. Ignacio Parisa from El País, some success stories, and then where have we succeeded and where have we not? In general, we've seen two different areas here. One that's important that has to do with informal efforts. That is to say, for the first time ever, we have cases that we can highlight in providing support to the informal workers. Brazil, Argentina are success stories of that, as is Chile. Colombia also in record time was able to implement transfers, and in the case of Mexico as well, Families in Action, Youth in Action. Again, these are all important programs that we have highlighted in the report. And I think, Ignacio, in this outlook, you will find what the experiences have been, what we've shown in terms of these programs. Some of them have been very successful, and in fact, can be reflected in the figures as to how we've been able to contain the downward spiral in poverty. My remarks are of a very general nature, but certainly we can see that you can look at the charts in the report with and without transfers. Somebody just gave me the chart, but I have to put my glasses on if I can find them. There they are. So, which countries, for example, have seen a very strong impact with? We have cases such as Brazil, where extreme poverty would have been 8, and with transfers, it's 1.1 in terms of extreme poverty. That is why we're giving the example of Brazil. In Chile, it would have been extreme poverty at 3, and we're at 1.6. In the case, let me look at what other case we have. But this is all, my dear Ignacio, it's on the table. You can look at this, the case of Panama, 10.9 with no transfers, 6.9 with transfers. And so I believe that on page 85 of the Outlook, you will find this chart where you can very clearly see all the countries in Latin America, because for the Caribbean, we don't have the detailed information, but you can see 2019, what the status was, what the poverty is with and without transfers. And I believe that we have done an extraordinary job. And I think that this requires a tremendous amount of work to be able to calculate all of this information country by country. And I want to congratulate my colleagues on doing that. It's all available in the Outlook.
The other question you had for me was, just let me refer to my notes. Success stories and failures. Right. Okay. Well, we prefer to talk about success stories. And I think one of the aspects we would like to underscore is that, well, despite the fact that all of these major efforts were deployed, I think it's important to mention that we have not been able to reach the extreme poverty line. 6 countries, Costa Rica, barely. And that's the goal. It's very important to reach that extreme poverty line. In other words, it's expanding the scope of the transfers and the coverage. Obviously, I think that it's very clear that those who were able to implement these transfer programs were successfully able, well, to a certain extent, to alleviate the poverty. That is, the poverty wasn't as bad as it would have been without the transfers. Now, we can see on the table that there were some countries that didn't make progress here, and I think it's very important. Therefore, I believe that the effectiveness and relevance of these transfers is absolutely, without a doubt, clear, and I think they need to be maintained throughout 2021 and, if possible, expanded. Also, I believe that it's important to target significantly women. I think there's an outstanding debt there, although the governments are taking action to contain domestic violence with helplines. What we need to do now is confirm whether the women are receiving the emergency transfers. And then digital inclusion, without a doubt, is another area that we need to target. We have agreed that it's important to reach the 40 million households that do not have access, and that would cost a significant percentage of the GDP. Well, not a significant percentage, it would be sufficient. And I think that's what we also need to do. That's on our list. And we also need to not necessarily target, but take a closer look at primary healthcare systems and make them more robust. Those countries with primary healthcare systems, for example, the Chilean system has been in place since the 60s, but it needs to be strengthened because primary healthcare systems will allow us to make our first line of defense more robust. That's one of the paths forward. Now, Cristina Gala from the Republic of Peru asks, how much has poverty increased in Peru and what is the forecast? When do you think we will be able to recover the pre-pandemic income levels? That's a challenging situation. Well, Peru, up until 2019, was showing a downward trend on the poverty rates. It dropped to 15.4% in 2019. So Peru had already made significant efforts in terms of decreasing their poverty rate from 2017 to 2019, when the rest of the region was headed in the opposite direction. So extreme poverty also dropped 2 percentage points during that same period. And in 2020, unfortunately, our forecasts indicate that there will be an increase in poverty of 1.5 percentage points. In other words, 21.8% will be the total figure. Now, the increase was not that much, thankfully, as a result of the public transfers. And without these transfers, the poverty rate would have reached 25.5% for 2020. Now, the situation in Peru clearly is cause for concern. Now, what are we proposing to further reduce the poverty rate? Well, to maintain these public transfers, to make sure that they are not stopped. It's very key, and hopefully to reach out to the extreme poverty. When do you think we could get back to the pre-pandemic income rates? Well, in the preliminary balance, we saw that Peru could be one of the countries with the greatest growth rate, 9%, in fact. It was one of the options for 2020. So this dynamic economy may actually translate into greater income and revenue. Of course, that's an estimate, and it will all depend on what happens. The world is known for its great level of uncertainty today, so it's challenging to come up with a reliable forecast estimate. Now, we really rely on vaccination to open our economies, and clearly Peru has robust raw material sectors, a dynamic economy, and obviously the structural asymmetries and gaps continue to be quite profound. We saw that the employment rate in Peru, the drop in the employment rate was one of the most marked. So
Muchísimas gracias.
thank you very much, Executive Secretary. Dear colleagues from the press, thank you so much for your profound interest in this topic and launching. We have received a wealth of questions. Unfortunately, we do not have enough time to answer them all. So we don't worry. the Public Information Division will do its best to answer your questions. And thank you for your participation. We have reached the end of this broadcast, and I would just like to give the final opportunity to the Executive Secretary for final remarks. Thank you to all of you who have taken part in this launching. I would like to thank you all for the questions. Unfortunately, we have not answered all of them. We have received a slew of questions, and I think there are several challenges. I would be remiss if I didn't mention. Now, hopefully our region will be able to reach a cooperation solution agenda for a more balanced, equitable path forward toward vaccination, because it all depends on how we can overcome the pandemic soon. The pandemic is not over yet. That's yet another message I would like to make sure is clear. And secondly, in the short term, obviously, we recommend maintaining these emergency monetary transfers. We have shown how important they are, that they are very necessary as a means to containing poverty. But I would have to say we need to increase the level and coverage. It's essential to address the situation that women are facing. Essential. We have to figure out how we can best come up with this society of care and attribute importance to care so that women can get back to work. And then with regard to our future direction, I think it's important to underline that our greatest challenge is to ensure that we have a state concerned with well-being. That's essential. And to this end, we need to significantly focus on the production structure. Without that, we won't get very far. So far, it's quite unequal, and we continue to ignore SMEs. We need to ensure that the value chains are more robust. We have seen that the health system has its weaknesses, and there's a great deal of informal work in the labor market. So these serious, profound structural issues are something we need to focus on, and we need to make sure we come up with a political, social, genuine, true compact that will seriously address the divide and inequality with regard to access that are common in our region, and the structural gaps as well. So hopefully we will have a positive future for the economy so that they will have the resources to address these structural deficiencies. I know that these topics were included in the list of questions, and I would like to request that my colleagues provide me with support in answering these questions online. We have run out of time, and I would truly like to thank all of you. Thank you to Simone Cicchini, our team, my team member. Simone has been one of the individuals leading this outlook, with Rolando, with Ana Westmes, Paulo Saiz, Alberto Arenas, and a wealth of other individuals behind the scenes. The list is very long. In fact, it's the entire organization, our ECLAC, that has mobilized its efforts behind this outlook. Mario Cimoli, Guido, everyone else who you cannot see, but they're here behind the scenes in this hall with making this digital experience a success. So I would like to invite you to please read the social outlook. Thank you very much. Thank you to the Executive Secretary, to thank you to everyone else who has joined us in this press conference. I would like to remind you that the ECLAC website will now have all of the informational input relative to this outlook. And the presentation, of course, will also be available in English and Spanish. And if you have any additional questions, please be sure to refer to the unit of public information. So, dear Executive Secretary, colleagues from ECLAC, members of the press who have joined us once again, thank you. Thank you for being here. We will see you soon. And ECLAC is in constant dialogue with all of you, and I'm sure there will be yet another opportunity to meet soon. Thank you very much.
In the very year that the United Nations launched the Decade